कल्याणम् आरोग्यं धनसम्पदा द्वेषबुद्धिविनाशाय दीपज्योतिर्नमोस्तुते दीपज्योतिर्नमोस्तुते। ओम शांति शांति शांति। नमन करें। रिलैक्स योरसेल्फ।
थैंक यू वेरी मच साक्षी। मैं कार्यक्रम को सीधे माननीय आज के कार्यक्रम के हमारे मुख्य अतिथि जो कि देश के सबसे स्वच्छ शहर इंदौर के लोकप्रिय सांसद हैं आदरणीय शंकर लालवानी जी हमारे इस वेबिनार में अपना आशीर्वाद देने के लिए जुड़े हैं। और श्री ब्रजेश गुप्ता जी से निवेदन करूंगा क्योंकि इस समय हमारे साथ पूरे देश विदेश से बहुत सारे एक्यूप्रेशर नेचुरोपैथी योग के प्रेमी हैं, तो माननीय सांसद जी का बहुत संक्षिप्त में परिचय बता दें। आदरणीय लालवानी जी अपने व्यस्त समय से हमारे साथ जुड़े, तो मैं आदरणीय गुप्ता जी से निवेदन करूंगा, प्लीज। सर आपका अनम्यूट करिए प्लीज। गुप्ता जी आपका अनम्यूट करिए प्लीज।
थैंक यू सर। आज दूसरे दिन आप सभी का स्वागत है। 4th इंटरनेशनल एक्यूकॉन 2025 में आप सभी का स्वागत, वंदन, अभिनंदन। आज हमारे लिए बहुत गर्व की बात है कि आज इंदौर के लोकप्रिय सांसद, मां भारती के लाडले, मां शंकर लालवानी जी हम सबका मार्गदर्शन करने के लिए हमारे साथ हमारे बीच उपस्थित हैं। वैसे तो आपके विशाल व्यक्तित्व का परिचय देना मेरे लिए संभव नहीं है, जैसे सूरज को दीपक दिखाना वैसे आपका परिचय देना, फिर भी संक्षिप्त परिचय मैं आपको दे रहा हूं। आप बीटेक की डिग्री मुंबई यूनिवर्सिटी से प्राप्त हैं। आप हमारे बड़े उच्च शिक्षित, ये हमारे लिए बड़ी गर्व की बात है कि आप इंदौर के उच्च शिक्षित सांसद हैं। 1999 से 94 से 99 तक आप इंदौर नगर निगम के पार्षद रहे हैं। आप 1994 से 2004 तक इंदौर नगर निगम के सभापति रहे हैं। 2013 से 2019 तक आप नगर निगम इंदौर के सभापति एवं आईडीए के अध्यक्ष रहे हैं। आपके कार्यकाल में आपने इंदौर के विकास के लिए एक नई गति दी, इसके लिए इंदौर आपका बहुत बहुत आभारी है। 2019 से लगातार आप इंदौर के सांसद हैं और सबसे ज्यादा भारत में वोटों से जीतने में आपने रिकॉर्ड बनाया है। और आप एक लेखक भी हैं। आपने एक बड़ी बुक लिखी है, मोदी के 100 मंत्र, जो अमेजन पर उपलब्ध है। ऐसे हमारे सांसद हैं। आप स्वच्छता, जैसे इंदौर में स्वच्छता में नंबर 7 बार 8 बार इंदौर आया है, वैसे ही आप इंदौर को स्वस्थ बनाने के लिए प्रयासरत हैं। और डॉक्टर AK जैन सर, SV पास इंटरनेशनल नेचुरोपैथी ऑर्गेनाइजेशन का आप हमेशा साथ देते रहे हैं। ऐसी हमें उम्मीद है कि आपका साथ हमें हमेशा मिलता रहेगा और हम इंदौर को आपके स्वच्छता के साथ स्वस्थ बनाने में पूरा योगदान दे सकते हैं, ऐसा हमारा मानना है, विश्वास है। तो मैं अब आदरणीय भाई साहब शंकर लालवानी जी से निवेदन करूंगा, आप हमारा मार्गदर्शन करें। थैंक यू भाई साहब।
धन्यवाद गुप्ता जी। मैं अंतिम जी को धन्यवाद देता हूं कि आज मुझे इसमें शामिल किया। ये मेरा संभवतः दूसरा या तीसरा मौका है आपके बीच आने का। और मैंने पहले भी इस बात को जिक्र किया है कि आपके माध्यम से वो जटिल बीमारियां, असाध्य बीमारियां भी ठीक हो सकती हैं। और इसको लेके इसका प्रचार प्रसार और बेहतर होना चाहिए, क्योंकि हम आम लोगों तक नहीं पहुंच पाए। जहाँ तक सरकार की बात है, सरकार ने इसको हमें और एजुकेशन में एजुकेशन में भी हम इसको किस प्रकार बेहतर कर सकते, पढ़ सकते, आगे के लिए भी सरकार प्रयास कर रही है। लेकिन आप सब जो इस विधा से जुड़े हुए हैं, मैं आपको बधाई देता हूँ। ये हमारी बहुत ही ऐसी विधा है, थेरेपी हम देखते हैं कि कोई जटिल समस्या आती है तो हो रहे हैं, तो लगता है कि इसका प्रचार प्रसार के लिए हम अपने अपने स्तर पे क्या और बेहतर कर सकते हैं, और आपको ऐसा लगता है कि सरकार और इसमें क्या बेहतर कर सकती है, तो आप जरूर सुझाव दें। अंतिम जी को मैं कहूंगा कि आप कुछ ऐसा हो जो सरकारी स्तर पर हो, चाहे केंद्र की सरकार हो या प्रदेश की सरकार हो, क्योंकि सब चाहते हैं कि सबका जीवन सुखमय हो, स्वस्थ हो। स्वस्थ, अगर मनुष्य स्वस्थ रहता है तो परिवार स्वस्थ रहता है, समाज स्वस्थ रहता है, देश स्वस्थ रहता है। और हाल ही में जो हमने एक सर्वे कराया था लगभग इंदौर में 2 लाख से ज्यादा, और अभी तो केंद्र सरकार ने भी उस पे सर्वे कर रहे हैं, कि हम देख रहे हैं कि जो हम नौजवानों में जिस प्रकार की बीमारियां बढ़ रही है वो चिंता का विषय है। जरूर हमको भी इसके बारे में सोचना चाहिए कि हम इसको लेकर किस प्रकार से बेहतर एक हेल्दी समाज और हेल्दी देश किस प्रकार से दे सकते हैं, उसके लिए भी आप लोग सब लोग विचार करें। पर मेरी ओर से शुभकामनाएं। मैं कोई एक्सपर्ट नहीं हूँ, मेरे को ये सुनना था, इसलिए मैंने कहा मैं ज्वाइन होऊंगा। मैं एक ऑन द वे हूँ, माननीय प्रधानमंत्री जी आज भोपाल आ रहे हैं, तो मैं आज भोपाल के रास्ते पे हूँ, तो मैं आपका ये सेशन सुनूंगा। तो जो मेरे लिए हो आप मुझे बता देना, मैं जरूर आपकी मदद करने के लिए तैयार हूँ। धन्यवाद।
धन्यवाद भैया, आपका आशीर्वाद पुनः हमें प्रदान करने के लिए। आप हमेशा निरंतर जब भी हम एक्यूकॉन करते हैं आपसे निवेदन करते हैं, आपका आशीर्वाद हमें हमेशा मिलता रहे, ऐसे ही मैं आपसे पुनः अनुरोध करता हूँ। आज हमारे इस कार्यक्रम में माननीय आयुष मंत्री इंदर सिंह परमार जी भी हमारे साथ जुड़ने वाले हैं, और मैं अभी हमारे साथ में जुड़ने के लिए आमंत्रित करता हूँ, साक्षी जी से रिक्वेस्ट करता हूँ कि आज हमारे साथ में राष्ट्रीय प्राकृतिक चिकित्सा संस्थान NIM की डायरेक्टर डॉक्टर सत्यलक्ष्मी मैम भी हमारे साथ हैं, और वो भी नहीं, तो वो कुछ ही क्षणों में हमारे साथ जुड़ने वाली हैं। इससे पहले मैं साक्षी जी से निवेदन करूंगा कि जो आज के हमारे कार्यक्रम के स्पीकर्स हैं उनके बारे में छोटा सा परिचय दे दें, और कुछ ही क्षणों में हम लगभग 10:30 तक अपने इस वेबिनार को शुरू करेंगे। तब तक हम सत्यलक्ष्मी मैम को कनेक्ट करते हैं, प्लीज।
थैंक यू सो मच सर। तो आज हमारे इस Day-2 एक्यूकॉन 2025 में फिर एक बार आप सभी का स्वागत है। हमारे मुख्य अतिथि के उद्बोधन के साथ हमारे आज के इस सत्र की बहुत ही सकारात्मक शुरुआत हुई है। आज हमारे साथ आज के इस इवेंट में हमारे कीनोट स्पीकर्स के रूप में डॉक्टर साहिल कपूर जी, डॉक्टर इंद्रजीत सिंह ढींगरा सर, मिस गायत्री नयन जीवी एंड डॉक्टर काजल गुप्ता मैम जुड़ेंगे। सभी के टॉपिक्स कल ही की तरह बहुत ही ज्वलंत और बहुत ही एनर्जेटिक होने वाले हैं। तो आज के भी हमारे इन स्पीकर्स का हम सभी कल के अनुसार कल की तरह रसास्वादन करेंगे। उससे पूर्व मैं संस्था की कुछ गतिविधियों और उसके संक्षिप्त परिचय आप सभी को देना चाहूंगी। SB पास सुंदरबाई फुलचंद जी आदर्श शिक्षा संस्थान, कंप्लीट होलिस्टिक ट्रीटमेंट एंड ट्रेनिंग सेंटर. I'm proud to introduce the SB Pass Institute based in Indore, Madhya Pradesh. For over 30 years, we have been dedicated to the field of education, healthcare, and holistic medicines. Under the visionary leadership of Dr. A.K. Jain sir, our institute specializes in yoga, naturopathy, acupressure, and acupuncture vidha. Our institute is since 2019-1, SB Pass has been affiliated with Acupressure Shodh Prashikshan एवं उपचार संस्थान प्रयागराज, ASPAS Prayagraj, and we are honored to collaborate with Indian Academy of Acupuncture Science Aurangabad, Association of Acupuncture Science Practitioner ASP Mumbai, and Ishan Bangalore. Our key programs and initiatives are the acupressure courses like certificate, diploma, and weekend online offline classes. International conferences on acupressure like Acu-con, which we organize annually. And international, and we are a certified institute from the Yoga Certification Board recognized by Government of India. We are conducting certified yoga professional training programs in which our students are serving globally. International Day of Yoga, 21st June, we celebrate in form of various health awareness camps, webinars, and various health awareness sessions. We celebrate Naturopathy Day on 18th November in form of health awareness camps in collaboration with NIN Pune. At SBPAS, we regularly organize pre-seminars, health awareness camps, and webinars, seminars to promote holistic healing, and our dedicated team is constantly working towards the mission. We are truly value your support in our journey. So, for today's सेशन नाउ अब हमारे साथ में जो सत्यलक्ष्मी मैम है हमारे सेकंड चीफ गेस्ट वे जरूर अब कुछ ही देर में जुड़ेंगे। उससे पहले मैं वेलकम एड्रेसिंग स्पीच के लिए श्री रविंद्र सर को आमंत्रित करना चाहूंगी। रविंद्र सर, ओवर टू यू।
Thank you, Sakshi ji. Good morning, my dear friends. We are extremely privileged to associate with SBPAS, who are conducting a human service in the field of acupuncture and naturopathy in the country, to promote it, to make our country medicine free. And effort, the Himalayan effort has been put by our beloved mentor of this movement, Dr. Antim Kumar Jain from Indore. And see, yesterday we have seen in the first day's conference how the legendary figures in the country have participated and given new insight in the what is not known hitherto in text, like Mr. Chirag Shah, Dr. Chirag Shah, he has told us what is mapping, how we can instead of the whole body by through mapping, how can we the example that
Ravindra sir, please unmute yourself.
am I audible now?
Yes, sir, now properly.
Okay, sorry. And Dr. Bharat Patodia has spoken about oncology and why in oncology any cancer can be treated by 5 elements. Because happen due to fire element, humidity, turbidity happen due to earth element, like that. And then Professor Archana Trivedi madam has told about why majority of the disease, 80% of the disease are Vata related. In the simplest, easiest form, how to treat Vata by finger number 1 and 2, 0, 1, 2 points. I mean, it's a new insight they have given. Today, also we have, I'm sure this day also we have the best of faculty and the legendary figures in the field of acupressure, and we are blessed to have amidst us the already our chief guest Sri Shankarlal Lalwani ji has blessed us. We are very proud and privileged to have him, and I full-heartedly once again welcome him and for his gratitude, for his generosity. We are always we are bound to show our gratitude to him. We are blessed to have him amidst us. And today, my dear friends, as our Sakshi ji has already said, we have Dr. Sahil Kapoor to speak on Divergent channel, and Dr. Inderjit Singh Dhingra will talk on sciatica pain. Ms. Gayatri Nainaji will speak on scientific evidence behind the efficacy of reflexology. She is a research scholar on reflexology. And my wholehearted welcome to our patrons, Dr. P.B. Lohia sir, Chairman of IAS Maharashtra, Dr. Rumi Beramji sir, President of MCA Maharashtra, Dr. Mayank Shahji, Dr. Hemant Takkarji, and the program will be successful only with these associates also who have supported us, like Association of Acupressure Science Practitioners, Mumbai, and then Indian Academy of Acupressure Sciences, Aurangabad, Acupressure Shodh Prashikshan Evam Muktar Sansthan, Prayagraj, and Ishan, Bangalore.
Ravindra sir, sorry to interrupt. Our chief guest डॉक्टर के सत्यलक्ष्मी जी हम सभी को ज्वाइन कर चुके हैं, तो मैं सभी की ओर से एसबी पास की ओर से आपका स्वागत करती हूँ मैम, और आज आपको ब्लेसिंग्स देने के लिए इनवाइट करती हूँ। उससे पूर्व आपका एक संक्षिप्त परिचय, योर शॉर्ट ब्रीफ इंट्रोडक्शन आई वुड लाइक टू शेयर. It is really my privilege to introduce Dr. K. Satyalakshmi, a highly respected leader in the field of naturopathy and yoga, currently serving as the director of the National Institute of Naturopathy, NIN Pune, with over 30 years of experience in clinical administration, academics, and research. She has been instrumental in advancing the science and practice of holistic healing. Dr. K. Satyalakshmi began her journey at Nature Care Hospital and College, Hyderabad, the first naturopathy institution in India, where she served as a professor. She later took on the role of director at Vamana Yoga Research Institute, Yoga Dhyana Parishad, Government of Telangana, before joining NIN Pune in 2015. Her contribution extends beyond administration. She is the chief editor of Nisargopchar Varta, NIN's bilingual magazine, and has played a crucial role in the publication of many textbooks, monographs, and research papers in the field of naturopathy and holistic health. Her dedication to education, research, and promotion of nature healing continues to inspire countless students, practitioners, and researchers across the country. We are really honored to have Dr. K. Satyalakshmi ma'am as our chief guest with us today, and look forward to learning from her vast knowledge and experience. I'd directly like to invite for blessings and good wishes. Welcome, ma'am.
Hello, can you hear me?
Yes, ma'am, you're audible properly. Welcome.
Yes. First of all, I would like to congratulate the SB PAS for taking various initiatives to sensitize people on methods of acupressure and acupuncture and reflexology, sujok. These are most simplest and easiest methods of healing, and putting one on the road to health with a knowledge that is gained through such training programs. So time to time, this kind of programs that are initiated by Dr. A.K. Jain and his team, and NIN is always with you, sir, and your team. And we wish that all those who are participating in this program will be immensely gaining knowledge in the field of acupuncture as part of this initiative. Thank you very much, and wish you all the very best. And whatever help and support needed from NIN, we are always there. Thank you.
Thank you so much, ma'am, for your blessings and good wishes. We are really privileged to have you here. तो आज के हमारे सत्र को अब आगे बढ़ाते हैं
Thank you very much,
और
ma'am.
जी
Thank you.
over
For
to
your-
sir.
Thank you very much, ma'am, for your blessing and best wishes. So now over to Achal ji.
Good morning, everyone. First of all, heartiest thanks to Dr. Satya Lakshmi ma'am for blessing us with your encouraging words. And now I would like to, introduce Dr. Sahil Kapoor. It gives me great pleasure to introduce sir. He is the son of Dr. Raman Kapoor, who is a Padma Shri awardee and a renowned acupuncture specialist in India. Dr. Sahil, in addition to being a very well-known allopath, is also doing some brilliant work in the field of acupuncture. He also has special interest in pain management. He has been working as a senior consultant at Kanpur Acupuncture Clinic in New Delhi for the last 8 years, and also as an associate consultant in Department of Medical Acupuncture at Sir Gangaram Hospital, New Delhi for the last 5 years. His education qualifications include MBBS degree from Goa in 2009 and an MD degree in anesthesia from Indore in 2015. He has also completed special acupuncture training from Nanjing University in 2016 and a postdoctoral certificate course from BHU in 2018. His topic for this conference is acupuncture treatment based on divergent channels. Over to you, Sahil sir. Please enlighten us with your knowledge.
Thank you, Anchal, for your introduction. I hope everybody can hear me clearly. Today I'm doing a very small topic. I try and use divergent channels. When I am treating resistant cases or cases which are very chronic, which are not responding. So because it helps me to get some good results for these patients. I'll just start screen sharing. I hope everybody can see the screen. Okay. So basically, we have everybody knows that there are acupuncture channels, and so there's something called as divergent channels also. Okay, which, as the name suggests, which diverge from the main channel, and like the main channel, the purpose of these channels are also the same. They help in transporting vital substances like qi, blood, jing, body fluids, and like normal channels, these can be lodged with pathogens. So we try and treat these channels and this, they kind of serve the same purpose as the primary channels. They help clear the pathogens and they help move qi, blood, and body fluids. So basically, we say that there are a total of 6 junctions for these divergent channels, the foot channels and the hand channels. The first junction is formed by the bladder and kidney. The second junction formed by the gallbladder and liver channel. Third junction by the stomach and spleen channel. The fourth junction by the small intestine and the heart channel. And the fifth junction by the sangya and pericardium channel. Sorry. Yeah. And the sixth junction by the large intestine and lung channel. So basically all the coupled channels. This is important. The channel distribution of the divergent channels throughout the body. The pattern goes Tai Yang, Xiao Yang, and Yang Min. And the paired yin channels follow the same pattern. So they're basically, as I previously mentioned, for regular channels, divergent channel also, basically there are pathogens that can enter these channels. So we can try and treat these channels, and that will affect the pathology as well as try and clear the pathogens. Okay. And since there are so many diseases, that we currently have, So we need help from these divergent channels to help us treat resistant cases, or and in some cases, if the condition is very chronic, maybe even the first session, second session only, I'll start treating these divergent channels, to get very good results. And the divergent channels are basically connected to the superficial layer. These are basically total 3 layers. The superficial layer, which basically includes the sinews and the connecting channels. The middle layer, which includes the primary channels and the internal organs. And the deep layer, which includes the 8 extraordinary channels. So just some basic information, so that everybody knows what divergent channels are. They basically, as I said, they are a branch from the primary channel. They flow through the major joints of the body. The sequence of the divergent channel usually begins at the knee. So as I said, the first junction, the bladder and kidneys. Then it moves up to the hip, then the chest, the shoulders, the throat, and finally the face. This is an ascending flow, goes from down to up. It implies that the channels can move vital substances and pathogens, usually upward and outward. So we want them to go out of the body. They can also move them from the interior to the exterior. So it goes out. The outward movement can release pathogenic factors and help in treating conditions. Inward movement can reinforce organs. A treatment can guide the pathogen through the pathways to be released and move pathogens up to be released by way of coughing, vomiting, sneezing, and with tears. The divergent channels distribute chi, blood, body fluids to the neck, face, head, and sensory organs. They flow more superficially and deeply than the primary channels. The divergent channels can also treat organs. Okay, they influence, as I said, the 3 layers: the superficial, middle, and the deep. The divergent channels, they do not have any points on their own, right? So they are nothing on their own. They can strengthen the connection of the yin-yang primary channels. They connect to their associated organs through the primary channel. Only the divergent and primary channels connect to their organs and can influence the internal organs. The sensory organs are in turn connected to the internal organs. Conditions of the internal organs can manifest through the sensory organs. Treating the sensory organs should be considered to clear the pathway of the organs and allow free flow of substances throughout the body. This concept is very important, the root and the end, because it describes the link between the internal organs and the divergent channels. It describes the beginning and the end of the channel, right? Some of the beginnings and the ends, could be different from the common confluent or union points that we learn, from Ling Shu. Ling Shu also says that it is at these beginnings and endings that the pathogens from the primary channels and organs can enter the divergent channels. So it forms the basis of why do we need to treat these divergent channels in clinical practice. Just to give a few examples, for Taiyang, like the root begins at bladder 67 and the root end or the ending ends at bladder 1, right? Anatomical area of the ending, as I said, since it's bladder 1, is the eyes. One more example, let's just take Shaoyin. Shaoyin, the root begins is kidney 1, ending ends at REN 23. The anatomical area of the ending is the throat, yes? So on and so forth. So we have to consider treating the beginnings and the endings in treatments along with treating the confluent points and the pathway points. Always add the beginning and the ending points. The confluent of the roots and endpoints can be used to begin a divergent channel treatment. The root and endpoints, they begin on the extremities located in areas where there are no confluent points. Thus, they offer additional ways, of how we can treat the divergent channels. The key to effective treatments is developing the ability to find the right amount of additional points for effective treatment. In modern application, we see that the internal organs, they take priority in diagnosis and treatment. The predominant model being the Zhang Fu. However, in classical acupuncture, the internal organs are one aspect of the body that is evaluated, not the only aspect. pathogens and imbalances can be located in the channels, not the organs, and throughout the body. Imbalances of the organs can be transferred into the divergent channel pathways. In either case, the divergent channels can be used to treat pathogens in the divergent channel pathways, as well as support the primary channel's ability to treat a organ condition. So I haven't gone through the entire list of the acupuncture channels and the conditions which they treat, because that is very common. We know which primary channel we use for treating what kind of condition. So I straightforward come to the guiding theories and principles for using divergent channels. As I mentioned, the basic for divergent channel, to understand there are three layers. They have divided the body into three layers: the top, middle, and bottom. They call it the Wei, the Yin, and the Yuan layers. Correct? The vital substances or pathogens can be located in one or in all of the three layers. As we see, the pathogens go from outer to inner, so from exterior to interior. Right? Diagnosing where the condition is located is very essential for doing an effective treatment. The external layer or the Wei layer includes the muscle. The superficial layer includes the muscle or the sinew and the connecting channels. The middle layer or the Yin layer includes the primary channels and the internal organs. The Yuan layer or the inner layer includes the 8 extraordinary channels. The divergent channels connect to and influence the Wei, the Yin, and the Yuan layers. The divergent channel's ability to influence all the three layers is what makes this divergent channel treatment so effective for chronic conditions. Treating the specific layer where the condition is located, as well as its corresponding channels, allows the practitioner to guide substances, that is chi, blood, body fluids, to a specific area. We can reinforce it there and guide the pathogens away from an area, which is reduce, or we can help treat stagnation. The divergent channels have the capacity to influence all three layers, which I said, which is why it is such a strong system which we should use. The one more principle of treatment is from beginning to the end. This is important. It represents a variety of acupuncture theories and applications. There are, for divergent channels, we have to understand two. Two are very important. The first being the depths of acupuncture. So as described above, there are three depths, right? V, Yin, and Yuan. The first depth is V is shallow insertion. Second depth is middle insertion. Third depth, Yuan, is deep insertion. So accordingly, the channels can be affected. For example, to influence the superficial layers, the sinews and all, we need to needle shallow. Similarly, so on and so forth. For the deep ones, like for the extraordinary channels, we need to needle deep. Needling the proper level proper depth is essential to having very good clinical results. So between no results or minimal results and very good results, this could be the main difference. The Lingshu also, so I said 2 points. One is the depth. The second is, if the condition is located at the upper body, you have to treat the lower body. This is what Lingshu says. And if the condition is at the lower body, treat the upper body. Also, the condition is at the head, treat the foot. Condition at the loins, treat the crease of the neck. So on and so forth. Right. So this is the principle of also is basically governing or saying it is treating mirror images or contralateral needling. This type of needling is based on two principles. First is the ability of one side of the body to treat the opposite side. Second is the understanding that a condition can begin in one location and move to another location. Correct? In clinical strategies, using the divergent channels, inserting the needles at the origin of the condition and moving to the opposite side of the body provides a very effective approach. What is emotions got to do with the divergent channel? The Lingshu says the root of spirit presents the emotions and the relationships to the internal organs. The primary channels are extensions of the organs. So conditions in the primary channels can influence the organs and the emotions. The divergent channels can assist in releasing the imbalanced emotional energy from the organs and the channels. Okay, so basically what is a clinical framework? This includes what all do we need to do. First, identify symptoms. What are the patient's primary symptoms? Okay, what disease is he suffering from? identify all your channels and organs that are imbalanced. So basically what classical acupuncture teaches us, ways of diagnosing, do that. We have to be clear about the channel and the organ being treated, as it is essential to help in effective treatment. The exact order of insertion of needles in the body is also very critical to attaining good results. A goal when needling the divergent channels is to stimulate their channels, which causes a reaction along the pathways and their connections. It is this reaction, the basic, or we call the Day-2. It is this reaction that is the basis of why the divergent channels can assist in treating the other primary channels and the. For example, if the patient had chronic anger, and he or she wanted to release this emotion and pattern, a liver and gallbladder channel treatment could be applied. Because we know that in terms of emotion, anger is concerned with liver and gallbladder. The Leo channel and the Leo channel points on the liver and gallbladder channels can be bled. Okay, you can use a needle or plum blossom, which is an outlet basically to allow the anger to more easily be released from the body. Modalities such as bloodletting, plum blossom, gua sha, moxibustion, they can also be included along with divergent channel needling treatment. So what is the treatment plan? First, select points along the divergent channel pathways. The points can be in the anatomical area of the condition. You can start with that. Second, select points with the same strategy for the divergent channels, yin-yang pair channel, as I mentioned. Third, select points from other channel systems that can treat the condition. For example, if there is organ deficiency, include a source point, C point, Mu point, Shu point, 5-phase reinforcement points. So basically you are combining your primary knowledge of classical acupuncture along with knowledge of how you can treat divergent channels. So you can think of it like an add-on treatment, right? As a composite treatment, right? As an integrated treatment. Consider adding other healing modalities, as I mentioned, moxibustion, bleeding, the lancet, plum blossom. They can be included in divergent channel treatments, correct? Okay, the divergent can be used with all channel systems. You can use these examples for creating your own treatments, right? First method, right? The first method is to treat conditions in the divergent channel pathways. For example, for treating the pathways of the divergent channel is when there is, for example, say B syndrome, right? We say for wind, damp, cold, say knee arthritis, wind in the B stage, B syndrome. Say this is for the spine from thoracic vertebra T11 to lumbar vertebra, sorry, L4. The treatment is to resolve and clear the B syndrome. A treatment can be to reduce the bladder and kidney divergent channels. These channels flow along the spine. The goal is to create an energetic flow that moves the B syndrome from the spine and the bladder and kidneys divergent channels and then out of the body. Method 2, when there is a diagnosis of internal organ deficiency, the divergent channels can be used to assist in reinforcing or providing important substances to the organ. For example, if there is spleen chi deficiency, very commonly we see in our medical practice, the goal is to reinforce the spleen. Strategy could be to select points on the spleen and stomach primary channel. The spleen and stomach divergent channel can be used to assist in the reinforcing movement. Okay, this creates a momentum that guides the chi to the spleen to reinforce. If there is a condition of stomach fire, the spleen and stomach divergent channels could in that case be reduced to assist in releasing and clearing the stomach fire. Method 3, say when a patient has back pain, for example, pain along the paraspinal muscles. Again, it is very commonly seen in medical practice, seen with our relatives also. The bladder and kidney divergent channels can assist in the treatment. Say if there is B syndrome, these channels would assist in clearing the B syndrome as well as circulating chi and blood to clear the channel and area. There are points on these channels that a practitioner may select for the standard treatment for back pain. For example, bladder 40, you can even bleed this, bladder 10, all the Hotojaji points. A divergent channels treatment can assist in relaxing the muscles, in moving the chi and blood, and in creating an outward movement of force to move the B syndrome pathogenic factors to the surface from where they can be released out. A standard sinew or a muscle or a outer layer treatment can include superficial needling to stimulate the Wei Qi. So we know that the Wei Qi lies superficially, which can release the pathogenic factor outwards. Adding cupping, gua sha, plum blossom, can help assist in this releasing function. Method 4, the classical application of the connecting channels is to treat blood conditions and emotions. The divergent channels can support the connecting channels when treating these conditions. They are especially effective in treating emotional conditions. For instance, if a person has repressed liver qi, and Hoon imbalance, plum blossoming the liver and gallbladder connecting points, liver 5 and GB37, is very effective. Applying a liver and gallbladder divergent channel treatment is very effective in bringing the emotional energy to the surface. Plum blossoming is a gentle way to create the outlet for the release. Classically, bloodletting with a lancet would be applied on the channel and points. The divergent channels can assist in treating both acute and chronic emotional conditions. Okay, method 5, the divergent channels can assist the 8 extraordinary channels, which is the deepest layer, to support other systems. For example, patient has chronic fatigue syndrome, okay, maybe fibromyalgia, chronic, with kidney iron deficiency. A DU channel treatment may be selected to reinforce the kidneys. A bladder and kidney divergent treatment can support the treatment plan. It can guide the vital substances from the DU channel to the kidneys. Combining these channels creates a very, very effective treatment. The divergent channels are a major part of the acupuncture system. Including them in your acupuncture treatments can increase clinical effectiveness very well. I'll be ending my PowerPoint with just one small case study just to summarize everything, So taking a very common case, 54-year-old male suffering from back pain ranging from T11 to L4 area, mostly paraspinal. Acupuncture diagnosis is B syndrome, wind, cold, damp. Western diagnosis, I said, could be arthritis. The treatment plan here is the bladder and kidney divergent channel pathways flow along the spine. These channels will be used for clearing the B syndrome. Okay, the B syndrome, as we know, is also influencing the muscle channels, the sinews, right, along the spine. The treatment plan will include clearing the B syndrome from the muscle channels and relaxing the muscle channels and the treatment strategy. These 5 points: release the bladder muscle channels first. Release the bladder and kidney divergent channels 2. Select acupuncture points in the local area to treat the local pain. Select acupuncture points to treat the B syndrome. Promote urination to assist in releasing the wind dam wound, right? Needling points UB40, UB10, DU20, needling DU16, DU6. The local Hotojaji points, say from T11 to L4, checking Ashi points. Needling Ashi points at Hotojaji points brings more specific results rather than needling all points. SI3, UB65, needle UB11, moxibustion, B syndrome, very effective. Treat UB64, UB28, source back shoe points of the UB, right? So you can add all these things to promote urination. Thank you for your patient listening. I hope I didn't take too much of your time and I was able to finish in the stipulated period of time. And maybe we can talk about divergent channels more. If I get a chance to speak in more upcoming lectures, and maybe we can talk about specific cases also. Thank you so much and take care. Thank you.
Thank you so much, Dr. Sahil sir, for a wonderful session. बहुत ही concise way में आपने इस brief topic को cover किया है, and we are really privileged to have you here. Thank you so much again. And now I'd like to directly.
Just a minute, Sakshi ma'am. Just a minute.
Yeah. Okay. Yes.
Thank you very much, Dr. Sahil sir, for the nicely explained for the new concept of the divergent channel. So if any questions, anyone, please hand raise. So we'll discuss with the sir. आप में से किसी का यदि कोई क्वेश्चन हो, कोई डिसीज को लेकर आप कुछ पूछना चाहें तो आप हैंड राइज करिए, हम आपको अनम्यूट करते हैं प्लीज। एनीवन, एनी क्वेश्चंस? ओके, नो क्वेश्चन। Thank you. Thank you very much, sir, for the joining us for this webinar. So now I request to Shri Brajesh Gupta, sir, please invite to our next speaker, Dr. Inderjeet Singh. Sir, please.
थैंक यू सर। आज 4th इंटरनेशनल एक्यू कॉन्फ्रेंस 2025 में आप सभी पार्टिसिपेंट का पुनः स्वागत है, वंदन है, अभिनंदन है। आज के हमारे नेक्स्ट वक्ता हैं देश के जाने माने प्रसिद्ध एक्यूपंचरिस्ट एवं होम्योपैथिस्ट डॉक्टर इंद्रजीत सिंह सर। आपका बृहद लंबा अनुभव, जिसमें आप 38 साल एवं 48 साल का अनुभव है। आप एक्यूपंचर मेडिकल कॉलेज लुधियाना के प्रिंसिपल हैं। एक्यूपंचर हीलिंग में आपका बृहद 48 साल से अधिक का दीर्घ अनुभव है। आप होम्योपैथी के जाने माने डॉक्टर हैं तथा वैकल्पिक चिकित्सा पद्धति में आपको 38 साल से अधिक का अनुभव है। आप देश विदेश की प्रमुख जानी मानी संस्थाओं के साथ जुड़कर मानव हितार्थ काम कर रहे हैं। आज हमें सर के बृहद एवं बड़े 4 दशकों के अनुभव का लाभ मिलने वाला है। तो मैं आप सभी से पुनः निवेदन करूं कि आप सर के अनुभवों का लाभ लें। मैं आमंत्रित करता हूं अगले वक्ता के रूप में डॉक्टर इंद्रजीत सिंह सर को। ओवर टू डॉक्टर इंद्रजीत सर।
प्लीज अनम्यूट योरसेल्फ। आज
ओके।
सर का जो विषय है हमारे साथ में सियाटिक पेन में रोल ऑफ द एक्यूपंक्चर को लेकर सर आपके साथ डिस्कस करेंगे। तो मैं पुनः आमंत्रित करता हूं डॉक्टर इंद्रजीत सिंह। वेलकम सर।
Good morning to everyone. It is my pleasure. We want to share our experience about the back pain and sciatica, but unfortunately, this time is my peak hour of the OPD. So that was the reason I'm little bit busy. So, and thank you for you have sharing my experience. I have a 50 years experience in acupuncture, and I am the one of the founder of the acupuncture system. Today, my presentation about the treating of the sciatica pain with the acupuncture. And this back problem and sciatica is the common problem in the presently in India, and not in India. We can say in the is a global present problems. So that was the reason we have do the study about the sciatica and back pain in the very different angles. And it is my pleasure to share to all of you. And this paper is presented first time from the international platform as a index with the acupuncture. I got the privilege to present this paper in WHO and also in the World Federation of Acupuncture Society. So now the contents about what we are going to be discussed about the introduction of sciatica, back pain, sciatic nerve root, pathogenesis, and what are the concerns with our system according to the meridians, and what are our diagnoses according to the modern medicine, according to our TCM, and how we treat the patient in our systems, and what are the results, and how can we give the permanent relief without surgery, without medicine to the countries. So back pain is defined as a pain of any nature felt in any region ranging from the thoracic region to the pelvic. And when the pain confirmed it is the low back pain. We simply say the low back pain. And the next is the sciatica and back pain. The generally pain is started in the low back pain, and patient cannot be stand properly and have very difficult and sharp pain in this the thoracic region, as well as the lumbar region, as the gluteal regions. One of the most common reason in the medical attention, why the modern medicine and WHO all are giving the press on the back pain problems. It is a common problem in 60 to 90% lifetime privilege, and 80 to 90% usually recurrent episodes because they have not get the proper relief, and many times they have a suddenly relief and then again it got the problem. And this is the disability of the working. This problem is the reason, and the patient cannot be work properly in the and disabled to do proper normal results. And the sciatica. See the sciatica roots, where it the pain start. Actually, we all know from the second number to the fourth, fifth number is the sciatic nerve, and the last is the jointly. It going to the gluteal region and back side of the thigh, and going toward the lower legs, and finally it ends in the liver. The sciatica is the syndrome involving in the nerve root and inflammation, progressive, and sometimes is the neurological symptom area supply in the affected area. That was due to the reason of the disc prolapse, as well as the punching of the nerve in the lumbar region. That was the common reason in problem in the modern medicine. Sciatica is the most frequent radicular pain syndrome in spinal regions. Occurrence due to the sciatic and spinal nerve root associated with the herniation. Herniation means disc prolapse when our disc between the 1 and 2 vertebrae disc is prolapsed, and that is the pressure will be occur on the nerve root. That is the part of this. Generally, this is involvement of the L4, L5, and L5 and S1. The lower portion is generally involved in these problems. Pain is due to, according to us, why the pain is occur. According to TCM, according to our Chinese system, pain is due to the stagnation or any deficiency of the qi in the meridian. Our common reason is a stagnation, is blockage, and the deficiency of any circulation in our meridians. The stagnation of qi and blood around the lumbar region. Major region is stagnation and of the qi and blood blockage in the lumbar region. Over the second cause, what we have the pathogenic found it is the more in the young generation, those who are suffering from the in the just 20, 25, 26, in up to 32 years, they are those who are indulged in the more sexual activity, they have a lumbar pain problems. As we know, the main reason, the essence of the kidney is reproductive organs. It produces the sexual power, it produces the pain. So when we have used the more sexual activity, it will be create the efficiency of the qi in the kidney. That was the cause of the back pain. And another, what is found according to our science, the deficiency of any kind, yin or yang, in the lumbar region, called the sort of yin narration and yang warming sports, because we know that when the deficiency in the kidney, either in the yin or yang, it will be create the less warmness of the kidney. That was also the cause of the back pain. Sciatica is the most frequent radicular pain syndrome. Just wait. Again. Sciatica belonging to category of the low back pain. Generally, we consider and according to TCM, we will not consider as a disc prolapse or nothing. We only categorize as a B syndrome. B syndrome means the painful condition of the body in anywhere it may occur. When it is occur in the lower back pain, if we consider the back pain is the cause of the T syndrome. Having the typical symptom like in along the low back pain outside of the leg, involving the meridian root, bladders, and gallbladder, etc. And these are the connection with our meridians. Actually, these are the meridians our we are flowing in this area, and that was the con. This is the lower portion when is the recurrent UV meridians and other are involved. And bladder meridian. First, everybody knows the root of the meridians. The meridian roots is the going from the top of the head and going to the up to the bottom of the fingers of the small toes and other things. This is the basically root where the pain is occur. So we can judge it, which meridian is involved in this connection. And sometimes the gallbladder, why gallbladder involved? Because generally the pain when it occurs, sometimes is from the below the knee, it's going to the lateral side of the side, and then it goes over the toes. That's why it means somewhere is the gallbladder meridian is also affected with the stagnation of the chi and blood. And the third meridian we can consider as a kidney. Why this we consider it? Because the kidney is the related with the reproductive and basically lumbar. Our condition is related with the kidney. This vertebral column of the kidney meridian start from the bottom and has a direct relation with the kidney, and it goes to the base. And sometimes the pain in the back view, that was the reason we cannot stand on the bed, because the lumbar is directly related with our kidney meridians. Next, some kidney meridians. Why? Some put where it involved all the things. Why the pain is going to is we know it. If somebody knows who are not from the medical side, they do not know the etiology of the according to the modern medicine. We just simply from the according to our DCM, we can go according to the root of the meridian and which root is the painful and which is where is the stagnation and where is the blood blockage is there. The concern of the meridian. Another few organs are and meridians are connected with the pains. That is the governing vessel. To my meridian is the head, and daima is the belt meridian. Because this pain is the where is the root. So because those who are unable to stand exactly, so it means there somewhere is the blockage in the stagnation involving the domai meridian, and those who have the pain in the west are belt area in the low of the lumbar and hip joining area of the lower extremity. It means thigh meridian is also involved in this condition. Generally, clinical science, this is the reason. Here it is lighting, this is the root of the pain where it the nerve maybe pain is the particular shooting type pain, sharp pain, radiation pain, referral pain, thinking and sometimes is the tingling pain. Patient is unable to stand, patient is unable to sit, patient is unable to express his view, and very severe pain in going through the lower region and feeling with the numbness, etc. According to the TCM, how we can be diagnosed when we know the root of the meridian where, so we have to take some help with the pulse, because and when the patient is generally came to us when he tried with the all other medical system, then the surgeon and orthopedic surgeon only suggested for the surgery, then they came to us. So the disease may be complex, so we have diagnosed according to our pulse system how we can which organ and which meridian is involved with this. So we diagnose with the according to the pulse first. And the rest of the vision, according to the TCM patterns. So second diagnosis our technique is the tongue diagnosis. Main basic role in our TCM is the one is the pulse diagnosis, because sometimes is the people has unable to diagnosis to the pulse. So we can take the help with the tongue diagnosis. Generally, pain in the if the region in the cold nature, the malodam nature, if aggravating in the winter season and cold days, it means we see the tongue of the condition. It will indicated the dampness. So according to our TCM, we need to be expel the dampness from the body. And the condition of the tongue is with white, sleepy, and coating, and pulse is very slow. These are the conditions we found in the according to the TCM. And the next, when if the blood is the stagnation, blood is the blockage, blood is the region of the fixed pain. So if somebody has sometime has no patient of the feeling of the referring pain toward the lungs, it means the local pain is the one area fixed. So we can say that somewhere is a blood stain is a station is there. So we diagnose according to the pulse, and because the pulse is that condition is a little bit dark and maybe purplish color, that is we can see. And if there is any deficiency in the kidney and the patient, the character of the pain is dull. Dull means there is no, sometimes pain is feeling but cannot be expressed where is the pain. And the pain is so developing in the slowly. Gradually it increasing. First is the slow mechanism. And it will be aggravated by the pressure and little bit of the physical strain, physical work, it will be aggravated. The pulse is very weak and just like a violin. And the meridian based, the generally when if how we can diagnose the along the kidney pain to meridian, the pain occur in the right in the middle of the lumbar region, center of the middle. When it the pain occur, it means the meridian is involved of the two meridians. If the center pain is there, when we just touch the lumbar area, we can say if the spinous process of the vertebra is painful, or the center of the place. If the pain is the center, it means kidney along with the two meridian is left and overlap to go to Duma meridian. And other blooded meridian and belt meridian is involved if the pain in the waist and around the waist and not referred toward the lower extremity, or sometimes we feeling the both buttock is heavy and both side pain is a dull and heaviness. It means the pain is involved in the due to the our UV meridians and the UV and also the belt meridians. These are the clinical diagnosis according to TCM, how we can diagnose with them, right? These are the one of the clinical diagnosis. If we just raise the legs, when the pain is feeling on the 60-degree angle, it means positive. We have the something between 70 to 30 to 70, it will be after some time. So severity of the pain and involvement of the these problems is we can diagnose according to the this way also. And other is the regulation sign. This is the when we start the knee bend, it feels sometimes the patient when we bend the knee and we just put it to the abdomen side, it will be feel the better way. It means the knee 90 degree. It means somewhere extension in the pain experience back from the thigh to the leg. These are another test where we can diagnose if the cycling nerve is involved or not. The radiography, X-ray, MRI, we can see these are the things. How what we diagnose. If we forget about the modern medicine, we see our own way. We have a different angles to diagnose according to MRI. One is the space between the one vertebra to the vertebra. We first check the space. The second is that this area we involve. any blackness, any stagnation, and any disc prolapse is we seen in the back, then we take. The another reason, we check the corner of the vertebrae. In any increase of the bones or enlargement, so maybe any osteoarthritis changes or spondylitis changes is there. So three angles we have to diagnose. The third, we see the exact state position of the vertebra. If it is not straight in the, and we say the bending of the spine is there, because when the patient has a back pain, generally he cannot be sit on the straight way. He just come where it is relief. So after long time sitting on the same position, the backbone is the turning position. So it's another reason we have discussed about reducing of the intervertebral disc space, because those who have a long time sitting work, long time working of the sitting, that may be the reduce the pressure on the vertebra, maybe because of the pressure on the nerves root. And MRI. So if we see the MRI, this area is the red where it say it is the disc prolapse, it is area. Soft tissue is impacted in seen in the abnormality, we can see where is the generally what modern medicine say, we only do the surgery, it will be cut it down and we can release the blood pressure. But according to our side, no need for the surgery, no need for the medicine. We have a different mode of the treatments according to our science. We can change all the things which are but first, what we discuss later on, how we treat the patients. And these are where is the pressure generally occur. You see in the report of the radiologist, he simply say the nerve pressure on the L5, L6 one is generally there. This is a common word they have used. But we have a different way to diagnose. Our way is first reducing the check the space of the vertebra, because that will be help to us if a person is working, which condition is working. Working condition is the sitting or long time standing. So it will be help to our diagnose, and what type of treatment is needed, we can help them. The primary treatment, generally, everybody is using the acupuncture, everybody is using the treatment, but little bit different. If your diagnosis, according to DCM, according to our meridian system, according to we diagnosed by the pulse, according to that, we can give the permanent relief, because the modern medicine say it will be take the medicine, you get the do the rest. But supposedly we will not suggest any rest. We say you do the work normally, whatever you do. The principal pain is to relieve. First, our aim to relieve the pain. How we can relieve the pain? We promote the chi of the meridians and upper circulation of the blood in the with the primary point selection of the point. Asi point means tendon points where it is. Generally, we select initially primary state from the dome meridians and garden meridians we commonly apply point we will select it. And primary ASI points are which are the generally points for the all of you know UB23 and UB25 and UB40 is the main point where if we just use the 3-point needle, it will be recovered. If somebody has feeling the diagnosis of the stagnation in the lumbar region is more, so we can bloodletting at the point UB40. UB40, we can use the just pick it or the 7-star needle is just we do the hammering around the UB40 and just do the cupping and few drops of the blood with vehicle. Immediately you get patient will feel the relaxation of the pain from the lumbar region. And acute condition of the patient is very short. It's very quick result because patient want to be immediately relieved because the patient does not relieve. So if the stiffness is there and the acute pain is in the lumbar region, so in the magic treatment we can say we select the SI3 and UB1 point is helpful, immediately relief, and some extra point UB7 point is the we can use for this condition. And during this manipulation of these 2 points and UB1 and SIY, ask the patient to just do the cycling on the relaxing on the sitting on the bed. And if we diagnose the cold and the region of the lumbago and the lumbar pain is due to the dampness of cold or kidney deficiency. So if the cold dampness, and we can use the warming needle or we can use the moxibustion apparatus we are using as a little wooden box in there. We put the moxa in there and we produce the heat in the particular area where it is needed. And the treatment. If the pain region is the cold dampness, first of the day, then do you do my 4-point Mingmen? Is generally point those ladies who are after the surgery and cesarean condition, they have a back, sometimes they have a back pain, and when they just catch with the cold or somewhere in the winter season, they have a little back pain and cannot reach it proper way. So big point, big man is that you go is the point where they are using the anesthesia purpose. So if we apply the needle on this point, and we just do the technique of the warming needle moxibustion, it will be help immediately to reduce the dampness of the. If any stress or blockage in the meridians, then we have the UB70 and UB32 is the main point where we can stimulate, as well as we use the bloodletting method from just 1 or 2 drops. We blood is from the UB70 and UB32. Immediately patient and dampness we can use and stagnation of the blood is removed. And in the kidney, the third position we have discussed with the kidney deficiency is the main cause. The UB23 is and UB23 is the main point for the kidney deficiency to check the kidney problem. If any sexual weakness region in the back problems, if any reproductive deficiency, it's less of the say essence produced by the kidney, that was the also caused the deficiency of the kidney and back pain. So UB23 is the main point where we stimulate as well as we do the moxibustion. And if somebody has a stiffness feeling in the lumbar, we can use some cupping pressure. But the cupping technique is do very lightly. Don't create the more pressure. It will be again harmful. And the increase the kidney ascent, we stimulate the kidney 3 point. And UB52 for the check the deficiency of the kidney. And this manipulation techniques is the reinforcing. We create the more energy in the meridians, especially in the UB23 and the U4. And it will be increase the deficiency of the young of the kidney. And it also we can use the technique of the moxibustion for this condition. My experience point generally, but now I experience, and one of my political leader is here. He's just very young, 32 years. He has a back problems, and when he got the acupuncture, he freed the completely leave, but repeatedly he again come and 2 or 3 months. And suddenly I take the history and it is related with somewhere with the sexual activity. And you imagine it, I just use 1 point UB1 and just after that, now is the 8-year passes, no pain in the lumbar region will be occur. So there after that, in the generally when the person of the young age came to our clinic, we just briefly take the diagnose and we check indirectly the person is not indulgence in the more sexual activity. If somebody is visiting your clinic, is young and have the repeated back pain and is the married or not married but have a different relation with them, so you can try the UB1. But of course, UB1 is the very risky point. Sometimes bleeding may be occur. So if you have a prevalent to use this technique, otherwise don't insert the needle. You can just use the pressure with the UV1 also. Meridian based care. If the person is suffering from the kidney and do meridian, then we can select these points. We have discussed already about SI3, extra 7, and GB23 is the main point where we can get the. If the kidney and bladder meridian is involved, UB60, 63, and K3 is the main point to increase the kidney essence in the body. The key point for the bladder area generally, sometime according to the symptom, we can add some more point. UB 58, 60, 62, UB 63, and your bladder 66, and UB 67 is the common point. We use the blood. But not always these points, always all combined. It will be selected 1 or 2 points in different time and different angle. In the gallbladder meridian, if the pain is the left side of the lower leg, then GB34 we can add, and GB41 is the main. These 2 points are the, if we combine it, if the pain is the lower leg, it will be recovered. If it is not recovered, any feeling in the gastric problems and heaviness in the lower extremity, then we can add GB37 and 39. We can add it. And Acu-con, generally these points everybody is using the GB30 and GB34 is 2 points. When there is no pain in the lumbar region, only gluteal region and lower legs, these 2 points is the sufficient point. If somebody has a cuff muscle pain, then we can add the UB57. And sometimes pain in the below of the gluteal region, then we will not use the GB30, bladder 36, and bladder 57 point is the helpful point, but check the pains. The efficiency of acupuncture and moxibustion is closely related to different cause of it. So now again is our diagnosis and our treatment technique is the main helpful for the giving the permanent relief of the lumbar, one of the lumbar disc. So generally people say this will be not come. Of course, this will be, this can be come in the same place. First, our aim to check the pain. Second, we release the relaxation, and which with the help of cupping and some yoga and other techniques, we can set up the disc of the lumbar. And many cases we have seen the disc will become. So because in our country it is very difficult before the MRI treatment we can get it. But later on, when repeatedly we need the MRI and X-ray, and the patient and other out. And only in my practice, I have taken the 2-3 cases where it will be correctly taken afford. So they have repeated. So we can see after the cupping and other techniques, motivation and actions and massage and physiotherapy will also help to the set of the disc in the proper place. No need for the surgery and other things. It is improved. So generally, an acupuncture and moxibustion relieve the pain. And for the disc prolapse rings put back, it will be help to other system as we have discussed, cupping and traction and massage. And tuna massage is the main helping hand to set up the. These are the way how we can do and advise to the patient and do these exercises and massage on which point to set up the disc. And this is my original research. This is the first time we have collaboration with the one medical college as well as our institution, and we have said is the result is there. And this the paper is internationally published, and first time in the country is my first paper of the institution, and I am very thankful to my colleagues who have helping me in for this research and projecting the present. Thank you very much to everyone. If any question, any answering, you can take 5 minutes so I can give the answer.
Thank you. Thank you very much, sir, for your experience you are sharing with us. Any question, any doubts, dear? dear friends, any questions?
Yeah.
Please handwrite if you have any questions.
Even later on, if you want to be any inquiry, any question, you can send the WhatsApp message, then we can give the reply, no problem. As a, this is a present problem, is the global present problems. And acupuncture is the best mode for the, without surgery, without medicine, for the back pain. Back pain is the common problem presently in the our whole world.
Okay. Now, Anisha, please unmute yourself.
Hello, sir. Sir, you
Yeah.
have, thanks a lot.
Please, question. But there is no question from the, I am not listening any question.
Jewelers of Joy, please unmute yourself.
Oh, repeat it.
Hello.
Yeah, yeah.
Good morning, sir.
Good morning.
It is a privilege to hear from such a prestigious person. Sir, I would like to know if we just have some stagnation in the UB meridian and we can feel some, like, some type of stiffness in the back. So what points can be used so that we can just clear the UB meridian?
SC, small intestine 3 is the main point to relax the stiffness in the lumbar region. And just ask the patient to lie down in the spine position and do the cycling on the just on the bed. Will be easy. If anybody, if he is not relieved, then you can also use the pressure point on the REN points. It will be
Okay,
generally.
but there is no pain, sir. There is no pain, but we can feel some stagnation is there, like, some clots type of, like some, you can, maybe I'm unable to express myself.
Stagnation means does not mean the clot is the block. And if the clot is there, that means the fully pressure root of the block. That will the different angle, different mode of the treatment. Stagnation is the partial pressure on the meridian root of the nerve. So that will we can live with very easily.
Okay.
And cupping also can help me, but the people just only see how they do the cupping. There are different methods. How much pressure you need be on the particular point, people majority does not know. That was the problem for us. So I must just suggest it. Do the light pressure to create the light vacuum on which through the cupping.
Thank you, sir. Thank you. Anyone, any question, please? Okay.
Okay. Now I request to everyone, this year we have completed the golden jubilee year of the acupuncture establishment in the northern India. I am the one of the founder of the acupuncture system, and I am the student of Dr. Vijay Kumar Basu. And most probably in October, because we have completed 9 December this year, but generally in the north is the too cold area. So we have discussed with our Chinese friends and Chinese doctor, especially, everybody, I am the first member of executive member, and the first president will be also participation in this. And we are planning 3-day program. One is the seminar program internationally, might be in Delhi or might be in Ludhiana, and 2-day program is here. One day is the whole celebration in somewhere in the, and one day we arrange the free camps for the awareness program. And we hope everyone will be participation with us. So we create help to us to create more awareness about acupuncture in the whole country. The government of India has accepted our proposal as accept the acupuncture in the health system, but still there is so many doubts is there. So very soon we have a meeting with the our health minister, we will create the problems and sort out the problems. But they have their mind, and but because the many pressure on us, they will not happy to give the independent system to the recognition. Health. They want to be at somewhere other medical system, Ayurvedic, homeopathy, and all the traditional system. But our aim is to get the independent system of the acupuncture that will be only help to us. So I request to everyone, thank you very much to the organizer also. Time to time we need to be enhance our knowledge of our colleagues, because the some of the colleagues has little knowledge, but they are giving insurance to the patient. What we have to, and the last 2 years ago, it happened in the Chennai, and somebody of acupuncturist has been diabetic can be cured with acupuncture. This type of awareness, this type of say, give surety, it will be all for the promotion of the acupuncture. I request to all of you, this will be not will be in future will be occur. And if anybody need the increasing of the knowledge, we will already always ready to give the our experience to all of you. Thank you very much.
Thank you, sir.
Thank you, sir. It was really pleasant to listen to, and I really want to thank you on behalf of our team for sharing your knowledge and experience with us. Your insight and valuable advice have been crucial in helping and succeed us, as you have taken most common topic on back pain and sciatica. We are so grateful for such a captivating session. Thank you, sir. And now I am delighted to welcome Ms. Gayatri to this forum today. She is an experienced researcher in my molecular biology and immunology. She also has a background in sports, health, and expertise in taekwondo, acupuncture, phlebotomy, reflexology. She is currently serving as operation analyst as Suga Suya Foundation, where they lead data analysis and research initiatives to improve operational efficiency. She has also worked as a teaching assistant in Open University of Sri Lanka and enhancing students' performance through innovative e-learning methods. A decade of experience in sports and health delivered over 1,000 treatment with high client satisfaction. Her background includes a master degree in molecular immunology, professional graduate diploma in law, certifications in reflexology, acupuncture, and phlebotomy. She also has a strong IT skills, proficiency in multiple languages, and wealth of experience in sports and volunteer work. Overall, she brings a unique blend of research, teaching, health expertise, leadership to any role. With this, I would like to request to share her wisdom to all of us. Over to you, Ms. Gayatri.
I'm so sorry. Thank you, Dr. Shivani, for your elaborate introduction. Thank you very much. Would it be possible for me to share my screen?
Yes, ma'am.
It says, all right, okay. All right. Good morning, all of you, esteemed guests and participants in this forum. If I may. Is my presentation visible to you all? Yes, okay, good. Right. I'm also thankful to Dr. A.K. Jain and Sundarbai Pulchandi Adarsh Shiksha Sansthan for this opportunity which has been given to me to present at this esteemed forum of the 4th International Acu-con Conference this year. I have been a participant before, and it gives me a great pleasure in joining this year as a presenter in bringing to this forum my expertise in research and also in reflexology. So I'm Gayatri Nayanjivi from Sri Lanka. I work as a reflexologist at the Citadel Entity Sports and Health Academy, and I'm also the country coordinator for the International Council of Reflexologists. So if I go with the introduction to reflexology, I am sure the forum has a wealth of participants who are well versed in complementary therapies, including acupuncture. So reflexology is a therapeutic practice which involves not only putting pressure on the feet, but also on the hands and ears as well. Usually, though it is mostly regarded as the feet. However, there are the reflex points that are used on the feet, hands, and ears as well. And in the modern day world, it is traditionally used for mostly for relaxation and health promotion processes rather than as a treatment strategy. If I look at reflexology, the basics of that underlie where the reflex points correspond to various organs and systems in the body. So if you would take the organs in the head are usually depicted on the toes, such as the pituitary gland and even the brain, which are depicted on the big toe, and also the glands, the other glands that are presented at the base of the sole in terms of a reflexology point of view. So what happens is that when we press these particular places which determine or correspond to various organs, they have an effect on stimulating or dysregulating these organs, thereby bringing about the balance of these systems. If I look at scientific studies on reflexology, now reflexology, or it is regarded as to be been there for thousands of years. Depictions are there from the Egyptian art as well, and also it is related to acupressure and such modalities in the Eastern world. But if you look at modern day, the reintroduction of reflexology by who is regarded as the father of reflexology or modern reflexology is Dr. William H. Fitzgerald. So there have been a numerous number of studies which have been done on reflexology and its efficacy in the various countries. Since my background is immunology, I have considered 5 studies which have looked at reflexology and how they have an effect on immune system related disorders, which provides scientific background on the efficacy of reflexology. So the first one is a 2007 study which evaluated anxiety, salivary, cortisol, melatonin secretion following a series of reflexology treatments. And the second study is one that has been done in 2009, which looked at the alterations in Th1, Th2 cell balance in breast cancer patients by using reflexology and also scalp massage. And the third study is one that has been done in 2011, looking at the effect of reflexology on pain and quality of life in patients with rheumatoid arthritis. And the fourth study is one that's been done in 2012, reflexology, a randomized controlled trial, which investigated the effects on beta endorphins, cortisol, and pregnancy-related stress. And lastly, a recent study done last year in 2024, which looked at the effect of reflexology on immunological parameters of people living with HIV. So the first study, which was done by McPicard and others in 2007, it looked at evaluation of anxiety levels, and salivary cortisol and melatonin are actually markers which are known as immunological markers, which have been looked at. In this study has been a pilot study which included 30 healthy volunteers. So the first set of results as to anxiety. This was based on a questionnaire before treatment and after treatment. So there was no significant in the pre and post anxiety levels. However, there was a significant difference in the state anxiety levels from the after treatment levels. That is in the if after reflexology treatment for a period of 2 weeks, they have identified in terms of state anxiety, they have seen a significant difference. Why this term significant difference I am mentioning is, in the scientific community, we would consider you have a high levels and then you have the lower levels, and you compare. You see at the first instance that there is a difference. But how it is regarded in the modern day scientific community is that difference significant? Is it due to only this variable that we are looking at, or could it be due to another variable? So what regards this as the variable? What brings about reflexology as the contributor to reducing anxiety levels is if it is significant or not. So in terms of state anxiety, they have seen that there is a significant difference. Then the other is looking at the salivary cortisol levels and the salivary melatonin levels. What they saw in terms of these measurements of the salivary melatonin and the cortisol levels, which are indicators of, which are actually also stress markers in saliva, is that they have also reduced. They have reduced, but however, unlike the anxiety scores, there was no significant difference. You will see that there is a reduction in these cortisol levels, but it was not significant. So thereby they concluded in this study that evaluation of anxiety had a positive effect by reflexology treatment, but they concluded that the salivary cortisol and salivary melatonin levels were not entirely reduced by reflexology. The second study which I looked at is the alterations in the Th1, Th2 balance. Now these Th1, Th2 types of types of immune cells, the WBCs, the white blood cells that we consider, they are considered to be giving the immunological responses. In terms of Th1 and Th2, either is it pro-inflammatory or anti-inflammatory. These they have looked at these types of cells in a control trial where they have used 60 breast cancer patients who underwent reflexology, 61 breast cancer patients who underwent scalp massage, and also 62 patients who did not undergo any complementary therapy and only underwent their traditional therapies of chemotherapy. This was done by Victoria and others in 2009. And what they looked at was these, as I mentioned, the Th1 and Th2 balance. So they looked at further cell types by immunofluocytometry. They looked at CD3 type cells and also immunological markers such as IL-4, which is the interleukin-4. So these are cytokines, which are immunological markers. They found that with time, the patients who underwent the reflexology treatment had lower levels of CD3 cells and also lower levels of the CD4 cells and higher or enhanced CD8 cells. So thereby, they concluded that there was reflexology was efficient in providing positive treatment by the for the breast cancer patients compared to scalp massage and those who didn't undergo any type of treatment. The third study was done by Taha and Ali in 2011. So there they looked at reflexology, the effects on pain and the quality of life in patients with rheumatoid arthritis. It was a quasi-experimental research design, which was not a randomized control. They looked at 50 patients who underwent reflexology with a 2-month follow-up. So they looked at, in terms of the quality of life, there was a significant difference in terms of their quality of life status before the treatment and after the 2-month follow-up period in terms of health and functioning, social and economic, psychic and spiritual, in terms of their quality of life satisfaction. Then they also looked at the quality of life importance and health and functioning, social and economic, and psychic and spiritual. These aspects were also shown a significant difference in terms of these parameters in quality of life. And also looking at the poor health status and how reflexology has affected them from uplifting from these poor health status. There has been a significant difference in how they responded in terms of before and after treatment, in terms of walking, self-care, reaching, and pinching. So these aspects have actually improved through this 2-month trial period, and also on the pain scales. So their pain levels have reduced in these rheumatoid arthritis patients after this reflexology treatment. So this study has concluded that reflexology has an effect on the changes in a patient's total quality of life, health status, and pain scores throughout intervention phases in a series of rheumatoid arthritis patients. The fourth study, done by McClaw and others in 2012, was also a randomized control study that investigated the effects on beta endorphins, cortisol, and pregnancy-related stress. So here they looked at patients, not actually patients, but 23 pregnant mothers, 23 pregnant mothers who underwent reflexology, another 23 pregnant mothers who underwent foot bath, and also 15 pregnant mothers who did not undergo any other type of special treatment. So they looked at the effects of blood levels of beta endorphins and cortisol. So these are also hormones that are indicators of the immunological status of a person. And there they found that in the group of who underwent reflexology, there was a positive difference in the terms of the cortisol levels than compared to the baseline levels of cortisol and cortisol levels, but they didn't see any significant difference in the beta endorphins. So the last study, the fifth study is one that was done in 2014 by Nison and others. It looked at the effect of reflexology on immunological parameters of people living with HIV. So I have included this as 2014 and 2024 both because their initial study was done in 2014, but they completed their study in 2024 because they initially looked at 45 patients and another 29 patients and compared them with 144 others who did not undergo reflexology treatment. So in this research, they have found that they have looked at CD4 cells and CD8 cells and the CD4 to CD8 ratio, which proves to be a good immunological parameter or marker to find out, which serves as to find out if reflexology or any other treatment has a positive effect on these patients. So here they have found that the CD4 cells were elevated and the CD8 cells were reduced throughout the course of the treatment group who underwent reflexology. Now, although there are these studies that have actually been done, there are a numerous number of limitations and criticisms. So in terms of the effect, most people in the Western medicine would argue that positive outcomes that are observed in reflexology studies may be due to the placebo effect. However, what was identified through these review of the literature that has been done so far is that there are a number of studies which have proved the efficacy of reflexology and even complementary other therapies as well. But what we are lacking is most studies have only been done in small sample sizes, and they have lacked these rigorous quality control studies, which by including healthy controls, thereby which shows it a bit difficult to draw the conclusions. So what we would see is that there is a need for larger, higher quality clinical trials to better understand the potential benefits of reflexology. So this is not only in terms of reflexology. We would like to show that these reflexology and even other complementary therapies, despite the limited research, the limited modern day research actually, these complementary therapies actually have a promise for many conditions. And what is actually needed is a little bit of push with the modern day rigorous research in order to prove the efficacy of these treatment modalities. So if we can focus on collaborative research in terms of well-designed and actually larger trials to better evaluate not only reflexology but also other complementary therapies as well, to look onto the effects of these specific health conditions in order to validate and bring about the area or the arena for better clinical application. So I believe that with a better collaboration with the research entities that are there and also the health sector, and most certainly with the positive focus that you have now in India. In Sri Lanka, we don't have a regulatory body for acupuncture, but then in India you do. I know it was after a very long effort from your end, from the acupuncturists, the pioneers who have been there and who have been fighting hard to get proper recognition. Sri Lanka has also had many pioneers and many people who have done a lot in terms of these complementary therapies, but so far we have had no luck in getting the regulatory body. But if we can, with these collaborations, if we are able to do larger trials with the approval, by getting the needed ethics clearances, and since the major thing that we see is, unlike other pharmacological studies that are being done, one advantage is that these complementary therapies do not have any detrimental side effects. But the one disadvantage that we have in comparing these, on researching these complementary therapies is, unlike the Western medicine pharmacological studies, we cannot perform them on rats or any other animals. We have to do it on people. So I believe that with the new focus that is being done towards the complementary therapies, we will be able to better understand and also provide a better application of the research studies that are being done, thereby proving the efficacy of reflexology and other complementary therapies, thereby giving the best possible treatment for the people in this world. These are the references which I have used for this presentation. And I'd like to introduce a little bit of my team. Dr. Cyril Anthony, who is the Executive Director, who is also a doctor in acupuncture and a long-standing acupuncturist. And also Dr. Udita Cyril Anthony, who does treatments and courses in sports massage. So as I mentioned, I am serving as a reflexologist in addition to my normal capacity as a reflexologist at the Cyril Anthony Sports and Health Academy, and I'm also the country coordinator for the ICR. And I believe that with this being said, I would hope for a better research platform for reflexology and other complementary therapies to bring about the best possible treatment for the people in this world. Thank you very much. Thank you, Dr. Jain, for this opportunity, and SB Pass for this opportunity to present at this forum. Thank you very much. Do you have any, if there are any questions, I would be glad to answer. Thank you.
If any questions are there, please raise your hands. Okay, thank you. Over to, okay, we have a question from A. Raval, ma'am. Yeah, ma'am, please unmute yourself.
Hello.
Hello.
Hello,
Yes,
Gayatri.
Ma'am, you've I did not hear the question.
Yeah, in one of your this thing you spoke that you had limited this thing research facilities. So in terms of resources, what else do we need, whether it be India or Sri Lanka? In terms of resources, what do you people need for more precise research?
Yes,
Maybe
I
you will
think
be needing some help of statisticians or data analysts.
yes. As I mentioned, so in terms of doing, let's say, all these research studies that I have cited in this presentation are ones that have been done in other countries. And as I said, we don't have a regulatory body in Sri Lanka, so we cannot do treatment trials or research in terms of reflexology and other complementary therapies in Sri Lanka due to the regulatory discrepancies that we have, which I included that in India, it's only now that you have got the regulatory body for acupuncture. So for reflexology, it's a long way ahead. But although we would consider that in the Western countries, they have a lesser or lesser view of reflexology and other complementaries, actually, they have a better view to or a platform for research. Because if I take, there is Dr. Kevin Coons, who's doing research on terms of neurological aspects of reflexology, where they are using MRI to look at or rather prove the efficacy of reflexology on the neurological standards. And also, so the if you look at the platforms of other research areas in India, Sri Lanka, and most of the world, we do have the facilities. What is not there is the collaboration between the researchers who are doing the original research in terms of other scientific modalities and complementary therapies. There is no there's very less, not that there is not, but then there's very less platforms for these areas to interact. And yes, there is a major need for the statisticians, biostatistics, in order to not only do the research, but also prove the research to be more valuable, or the results of the research to be valuable. I hope my answer is sufficient.
Thank you so much, ma'am, for your knowledgeable insights on reflexology along with the scientific evidences. We are really grateful to have you on our platform. Thank you.
Thank you.
Coming up next, we have our last speaker, Dr. Kajal Gupta. Dr. Kajal Gupta has completed her BNYS and MSc in clinical psychology, along with various other fellowship programs of acupuncture and research methodology. She is currently working as a medical officer in NIN Pune. She is a healthcare professional with 10 years of experience in clinical field and academics. She has her specialization in the fields of naturopathy, acupuncture, nutrition, health, wellness, medical education, and counseling. Dr. Kajal is a TCM enthusiast and imparted acupuncture as a therapy in combating and management of numerous health and disease conditions, especially infertility, mental health, and other lifestyle disorders. She looks forward to bring a change in unhealthy lifestyles through naturopathy, yoga, and energy medicine. As a researcher, she has a vast experience in studies for efficacy of acupuncture for various metabolic and lifestyle diseases. Looking forward to hear from you, ma'am, on the topic The 5 Elements of Health, Insights from TCM. It's a very important topic, so we are really looking forward to hear from you. Over from you, ma'am.
Thank you so much, Darshana. I hope my voice is audible for all of you.
Yes, ma'am, it's audible.
Okay. So I'll just start my presentation. Just give me a minute. Okay. So is my screen visible?
Yes, ma'am, it's visible.
Okay. Yeah. Good afternoon, everyone. Thank you so much, Darshana, for a beautiful introduction. I am Dr. Kajal Gupta, working as a medical officer at National Institute of Naturopathy, Pune. And I'm really grateful to be a part of Acu-con 2025, which is arranged by SB Pass by Dr. Acu-con. And I'm very much grateful for this opportunity, because as a part of NIN, we have a very good rapport and connection with SB Pass, as we are collaborating with so many other activities which is related to naturopathy and yoga. So thank you so much, sir, for calling me, for sharing my views on the 5 elements of health from the perspective of traditional Chinese medicine. So today, since morning, we all are talking about how TCM or how acupuncture is good for sciatica. Dr. Gayatri has very beautifully explained that what and all activities and what and all researches are already going on, which is regarding reflexology. And also we talked about how the divergent channels which are there in TCM or there in acupuncture and that we are using in terms of health. अभी जो हम बात करने वाले हैं वो इसके बारे हमने जैसा मैंने पहले बोला कि हमने डाइवर्जन चैनल्स पढ़े, हमने सियाटिका पढ़ा, हमने ये भी सीखा कि हमारे पास कितने सारे रिसर्चेस जो ऑलरेडी हो चुके हैं. मैं स्टिल आप सबको दोबारा वापस थ्योरी पे लेके आना चाहूंगी, क्योंकि कोई भी जब हम रिसर्च करते हैं या कोई भी जब हम एक पर्टिकुलर डिजीज के लिए थेरेपी के बारे में बात करते हैं, या फिर हम किसी भी चीज के बारे में बात करते हैं जहाँ पे हम एक मोडालिटी यूज करना चाहते हैं, उससे इन सब एक्सपेरिमेंट से पहले जो सबसे ज्यादा इम्पोर्टेंट चीज है वो है कि हमारे बेसिक्स कितने ज्यादा स्ट्रॉन्ग हैं. किसी भी बुक में, किसी भी रिसर्च में, किसी भी टॉक में, जब भी हम whenever we are talking about acupuncture, the few theories which are known to everyone yet unknown to anyone, and five element is one of them. हम सब ने फाइव एलिमेंट्स के बारे में, पंच महाभूता भी हम इसको बोलते हैं अगर हम नेचुरोपैथी पर्सपेक्टिव से देखें या नेचुरोपैथी लैंग्वेज में देखें, पर ट्रेडिशनल चाइनीज मेडिसिन में हम इनको फाइव एलिमेंट्स के नाम से जानते हैं. हमारे पास जब हम लाइक 5 एलिमेंट्स हैं, विच इज वुड, फायर, अर्थ, मेटल एज वेल एज वाटर. इन पांचों एलिमेंट्स को हम अगर अपने रोजमर्रा की जिंदगी में, इन एवरीडेज लाइफ इफ वी सी, ये पांचों एलिमेंट्स हमारे आसपास प्रेजेंट हैं, पर इन पांचों एलिमेंट्स को हम डायग्नोसिस के तौर पे कैसे यूज कर सकते हैं, और हम कैसे ये जान सकते हैं कि ये पांचों एलिमेंट्स की अगर कोई भी ऊंच नीच होती है या कोई भी अगर इम्बैलेंस होता है इन पांचों एलिमेंट्स में, तो वो कैसे एक डिजीज के तौर पे एक ह्यूमन बॉडी में मैनिफेस्ट करता है, या आप कैसे उन सिम्टम्स के बारे में चेक करते हैं. जब एक ह्यूमन बॉडी आपके पास एक डिजीज लेकर आती है, एक पेशेंट आपके पास अपने चीफ कंप्लेंट्स लेकर आता है, तो आप कैसे जान सकते हो कि ये जो 5 एलिमेंट्स हैं जो जनरली इन्वायरमेंट के हैं, नेचर के हैं, पर वो आपकी बॉडी में कैसे उस चीज को मैनिफेस्टेशन करता है. सबसे पहले हम देखेंगे कि जो ट्रेडिशनल चाइनीज मेडिसिन है, ये अपने पांचों एलिमेंट्स को, 5 एलिमेंट्स को किस लेंस से देखता है, या हाउ इट शोज और हाउ इट सीज दोस 5 एलिमेंट्स. इफ आई टॉक अबाउट वुड, लेट्स से फर्स्ट, हम पांचों के बारे में धीरे धीरे सब डिटेल में जानेंगे. मैं सिर्फ एक बैकग्राउंड देने के लिए अगर मैं आपको बोलना चाहूँ, तो ये जो हमारे 5 एलिमेंट्स हैं, जैसे वुड है, राइट, ये एक ऐसा एलिमेंट है जिसकी ये सिर्फ एक्सपैंड कर सकता है. ये हमारी बॉडी में जो रिप्रेजेंट करता है वो है कि हमारी बॉडी में जो भी चीजें एक्सपैंड हो सकती हैं, अपनी साइज से बढ़ सकती हैं, जिसको हम जनरली हाइपरट्रॉफी बोलते हैं, या फिर हम जिसको साइज में इंक्रीज होना, जिसको हम मेगैली बोलते हैं, वो चीजें रिप्रेजेंट करता है. Now that can be based on the organ, visceral organ, that can be also related with the other vital substances. दूसरी चीज है हमारे पास फायर. हम सबको पता है कि जो फायर का मूवमेंट है, या जो फायर की हमारी प्रॉपर्टी है, कैरेक्टरिस्टिक है, वो सिर्फ एक है कि हमने कभी भी फायर को ऊपर से नीचे जाते हुए नहीं देखा. वी हैव नेवर सीन अ फायर गोइंग डाउनवर्ड्स. फायर का ग्रेविटेशनल फोर्स पे, या ग्रेविटेशनल फोर्स का फायर के ऊपर हमेशा दबाव रहता है कि फायर ऑलवेज हैव मूव अपवर्ड्स. तो जितने भी सिम्टम्स हमारी बॉडी में नीचे से ऊपर की तरफ मूव करते हैं, जैसे कि नोजिया, वॉमिटिंग, या फिर अगर आप बोल सकते हैं कि हेडेक, एनीथिंग विच इज प्रेजेंट अबव the lower level of the body, that represents fire. The third element comes as earth. Now we all know the very basic characteristic of earth as well as of हमारी जो पृथ्वी है, उसका जो सबसे पहला काम है वो है हमें नरिशमेंट प्रोवाइड करवाना. आप जो भी चीजें, जो भी सीड जो है, चाहे वो फूड के तौर पे, पानी के तौर पे, हवा के तौर पे, जब आप अर्थ को देते हैं, राइट, तो उसका जो बेसिक फंक्शन है वो है आपकी बॉडी को नरिशमेंट प्रोवाइड करवाना. नेक्स्ट है मेटल. मेटल की हमेशा जो प्रॉपर्टी रहती है हमारी बॉडी में, दैट इज मोर ऑफ कॉन्ट्रैक्शन एंड दैट इज ऑल्सो मोर ऑफ मोबिलिटी. कि कोई भी चीज को जब आप फोल्ड कर सकते हो, कोई भी चीज को जब आप एक जगह से, या जैसे हमारे जॉइंट्स हैं, राइट, जब आप उन चीजों को अपनी मोल्डेबिलिटी कर सकते हैं, या वो अवेलेबल मतलब पॉसिबल है उनको मोल्ड करना, उसको हम मेटल के साथ में रिप्रेजेंट करते हैं. द नेक्स्ट वन इज वाटर. वाटर वी ऑल नो, इट्स लाइक द प्रॉपर्टी ऑफ वाटर इज फ्लूइडिटी. तो हमारी बॉडी में एक वाइटल सब्सटेंस के नाम से हम उसको जानते हैं जो है ब्लड एज वेल एज बॉडी फ्लूइड, जो कि दोनों ही फ्लूइडी नेचर के हैं. तो जो हमारा पानी है या जो हमारा 5 एलिमेंट्स में द वाटर एलिमेंट है, दैट रिप्रेजेंट्स द फ्लूइडिटी इन आवर बॉडी. Now these elements are also connected with each other. ये पांचों एलिमेंट्स हमारी बॉडी में अलग अलग तौर पे प्रेजेंट हैं, पर ऑल्सो ये जो पांचों एलिमेंट्स हैं वो आपस में भी एक दूसरे के साथ कनेक्टेड हैं. एज अ एक्यूपंक्चरिस्ट हम सब एक्यूपंक्चर प्रैक्टिस करते हैं हमारी क्लिनिकल्स में, हमारी रोजमर्रा की लाइफ में. अगर हम ये जानना चाहें कि ये जो 5 एलिमेंट्स हैं ये आपस में कैसे कनेक्ट करते हैं या आपस में कैसे कनेक्टेड हैं, हमारे पास ट्रेडिशनल चाइनीज मेडिसिन में इसके बारे में 4 साइकिल्स के बारे में बहुत ब्यूटीफुली एक्सप्लेन किया है. द वेरी फर्स्ट वन इज जनरेटिंग साइकिल, जिसकी वजह से या जिसके साथ में हम मदर एंड सन लॉ थ्योरी के बारे में बात करते हैं. जनरेटिंग साइकिल का मतलब है कि कोई भी एक एलिमेंट है जो कि रिस्पॉन्सिबल है दूसरे एलिमेंट की प्रोडक्शन के लिए. फॉर एग्जाम्पल, जब भी अगर हम जो साइकिल है, अगर हम उस साइकिल के बारे में देखें, तो जो फायर एलिमेंट है वो जनरेट करता है अर्थ को. तो उस हिसाब से जो हमारा फायर है वो है मदर ऑफ अर्थ. सेम अर्थ हमारा जनरेट करता है मेटल को, मेटल करता है वाटर को, वाटर करता है वुड को, एंड अगेन वुड करता है फायर को. तो हर एक एलिमेंट जो दूसरे को जनरेट कर रहा है दैट इज मदर, और जो जनरेट हो रहा है दैट इज सन. सो दैट इज हाउ वी कॉल इट एज मदर एंड सन लॉ. और ये जो 2 कनेक्शंस हैं और जो 2 एलिमेंट्स हैं वो आपस में एक मदर एंड सन लॉ के या मदर एंड सन कनेक्शन के तौर पे आपस में कनेक्टेड है. दूसरा साइकिल हम बोलते हैं कंट्रोलिंग साइकिल, जिसमें हम ग्रैंड मदर एंड ग्रैंड सन लॉ के बारे में बात करते हैं. जिसमें अगर आप देखोगे जो कनेक्शन है, दैट कनेक्शन इज बेसिकली कि आपका जो वाटर एलिमेंट है वो ग्रैंड मदर है फायर का, फायर ग्रैंड मदर है मेटल का, मेटल ग्रैंड मदर है वुड का, वुड ग्रैंड मदर है अर्थ का, एंड अदर अर्थ है ग्रैंड मदर वाटर का, जो कि बीच में जनरली अगर हम देखें तो स्टार के शेप में पाया जाता है एक सर्कल में. ये है उनका दूसरा कनेक्शन. ये जो दोनों कनेक्शंस हैं, चाहे हम जनरेटिंग साइकिल के बारे में बात करें या फिर हम कंट्रोलिंग साइकिल के बारे में बात करें, ये दोनों साइकिल्स जो हैं ये हमारी बॉडी में नॉर्मल फिजियोलॉजी को दर्शाते हैं, या जो भी हमारी बॉडी में फंक्शंस हैं जो विच आर हैपनिंग ऑन अ एवरीडे बेसिस, वेदर यू कैन टॉक अबाउट रेस्पिरेशन, वेदर यू कैन टॉक अबाउट digestion, whether you can talk about excretory system, whether you can talk about anything like which is related with these 5 elements. So these 2 cycles are responsible when we are talking from a perspective of TCM. Same way, अगर इन 2 cycles के बीच में कोई भी imbalance होता है, right? तो 2 imbalance के बाद में उस cycle का नाम हम generally as a TCM और as a acupuncturist हम diagnose करते हैं. That is either it is called as overacting cycle, either it is called as insulting cycle. The overacting cycle is as equal as controlling cycle, but उसमें सिर्फ जो एनर्जी है, जो ची है, या फिर जो हमारा पहला वाइटल सब्सटेंस है, मैग्नीट्यूड ऑफ ची जो है, वो इन द ग्रैंड मदर एलिमेंट इज मच मोर देन द ग्रैंड सन एलिमेंट. तो जब भी इम्बैलेंस हुआ एक ग्रैंड मदर और एक ग्रैंड सन के बीच में, या फिर एक एलिमेंट और दूसरे एलिमेंट के बीच में, जो आपस में वो ग्रैंड मदर और ग्रैंड सन के तौर पे कनेक्टेड है, अगर उसमें से ग्रैंड मदर का जो एनर्जी है, जो ची है, अगर उसका मैग्नीट्यूड ज्यादा हो जाता है, तो हम उसको पैथोलॉजिकल साइकिल का नाम देते हैं, विच इज नोन एज ओवर एक्टिंग साइकिल. सेम वे, अगर इस साइकिल का जो मैग्नीट्यूड है अगर ऑपोजिट हो जाए, फॉर एग्जाम्पल अगर ग्रैंडसन का मैग्नीट्यूड ऑफ एनर्जी जो है, इफ इट बिकम्स मोर देन द ग्रैंड मदर, दैट पर्टिकुलर साइकिल इज नोन एज इंसल्टिंग साइकिल. तो जब आप 2 कनेक्शंस के बारे में बात करेंगे, 2 एलिमेंट्स के बारे में बात करेंगे, वो हर एक एलिमेंट एक दूसरे एलिमेंट के साथ में कनेक्टेड है. So whenever a patient comes to us, whenever we are talking from a clinical perspective, whenever a patient is there, the only job of any acupuncturist or any Chinese physician or an Indian physician who is practicing acupuncture, हमारा जो काम है या हमारा जो फर्स्ट लाइन ऑफ ट्रीटमेंट है या फर्स्ट लाइन ऑफ प्रोटोकॉल है, वो इसी से होना चाहिए, दैट टू अंडरस्टैंड कि वो 2 कनेक्शन कौन से हैं. कौन से कनेक्शन के साथ में जो एक पेशेंट की बॉडी में जो डिजीज है वो डेवलप हो रही है. दैट इज व्हाट you can say the 5 element when we get to know that how it is connected with the human body. Okay. Is my screen not visible? Or can you see my screen?
Ma'am,
Yes,
we can
it is
see your
visible.
screen, but it's not moving. Slides are not moving, ma'am.
Yeah, I'm not moving yet. I'm like, it's the first slide itself.
Visible properly.
Yeah. So here I am talking only about the second point. If you see in my slide, that is, these elements are representing the dynamic process, but they are also connected with each other. What I just explained about the 4 cycles, in which 2 cycles are of physiology and the 2 cycles are of pathology. These cycles are basically the interrelationship between 2 bodies, or interrelationship, you can say, between 2 elements. So when I'm talking about understanding these elements, that how a disease happens or how the health happens, the very basic understanding is that we just have to balance these elements with the same magnitude of energy. अगर सब में एनर्जी सेम है, अगर सबकी एनर्जी इक्वली डिस्ट्रीब्यूटेड हो रही है सब ऑर्गन्स में, सब एलिमेंट्स में, देन इन दैट केस हम उस चीज को एक्यूपंक्चर में बोलते हैं दैट द पर्सन इज हेल्दी इनफ. इन केस कभी भी इन एलिमेंट्स में जहां पे भी इम्बैलेंस होता है, चाहे वो किसी एलिमेंट में हो रहा है या फिर चाहे वो किसी ऑर्गन में हो रहा है या ऑर्गन की एनर्जी में हो रहा है, उसको हम टीसीएम की लैंग्वेज में बोलते हैं द पर्सन इज डिजीज्ड. नाउ ये कॉन्सेप्ट क्या है 5 एलिमेंट का? जो हमारा 5 एलिमेंट का कॉन्सेप्ट है वो सबसे पहले जो शुरू हुआ था, दैट हैज स्टार्टेड फ्रॉम यिन एंड यांग थ्योरी. वी ऑल हैव अंडरस्टूड, वी ऑल हैव नोन अबाउट यिन एंड यांग थ्योरी. हम सबने सुना है कि इट्स अ स्टोरी ऑफ a mountain, right? All of us have heard about that, how yin and yang came into picture. There is a mountain. उस माउंटेन के एक साइड पे जो है वो सनराइज होता है, and the other side where the sun sets. Now, how the body is exactly divided into yin and yang? The upper body part is representing yang, the lower body part represents as yin. When you're talking about a right hand or the right side of the body, that's yang. Left side, it's yin. Yin is more feminine in nature. Yang is more masculine in nature. Anything which is not moving, that is yin. Anything which is into the movement, that is yang. जो भी चीज stagnated है वो yin है, जो भी चीज cold है वो yin है, जो भी चीज feminine है वो yin है, whereas जो भी चीज heat रिप्रेजेंट करती है, फायर रिप्रेजेंट करती है, वो यांग है. तो हमारी जो चाइनीज फिलॉसफी थी वो एक चाइनीज मोनाड से शुरू हुआ था. चाइनीज मोनाड एक नथिंग बट इट्स जस्ट अ सर्कल which is divided into 2, that is yin and yang. It's a black and white circle, you can see a picture down. Now when I'm talking about this yin and yang, it is basically nothing about, it's a representation of a human body having both feminine and masculine characteristics. अब ये जो each yin and yang है वो हम organs में भी differentiate करते हैं. अगर आप देखेंगे 5 element में हमारे पास 5 element हैं, पर हर एक एलिमेंट के पास में 2 ऑर्गन्स हैं. उन 2 ऑर्गन्स को ही हम एक यिन ऑर्गन और एक यांग ऑर्गन बोलते हैं. हमारी बॉडी में जितना भी एनाटॉमिकल स्ट्रक्चर है, जो भी हमारी बॉडी में स्ट्रॉन्ग स्ट्रक्चर है, या आप बोल सकते हैं कि हमारी बॉडी का जो एनाटॉमी है, राइट, हमारी बॉडी में यिन रिप्रेजेंट करता है जो कि एक सॉलिड स्ट्रक्चर है. बट हमारी बॉडी की जितनी भी फिजियोलॉजी है, चाहे जो भी हम फंक्शन कर रहे हैं, ब्रीदिंग कर रहे हैं, रेस्पिरेशन कर रहे हैं, खाना खा के डाइजेशन हो रहा है, एक्सक्रीशन हो रहा है, रिप्रोडक्शन हो रहा है, ये जो सारी थ्योरीज हैं या ये जो सारे कॉन्सेप्ट्स हैं, ये फिजियोलॉजी है. और हमारी बॉडी में इसको यांग का पार्ट बोला जाता है, राइट. अभी जब हम यिन एंड यांग के बारे में बात करें या फिर हम एक एलिमेंट के बारे में बात करें, हर एलिमेंट के 2 कनेक्शंस हैं, हर एलिमेंट के 2 ऑर्गन्स हैं. उन ऑर्गन्स में जो एक सॉलिड ऑर्गन है वो हमारा यिन है, जो एक हॉलो ऑर्गन है या जिसमें फिजियोलॉजी पॉसिबल है या जो फिजियोलॉजी करता है वो एक यांग ऑर्गन है. हर बॉडी का ऑर्गन अलग है, इमोशन अलग है. अगर आपके पास हमारी ह्यूमन बॉडी के टोटल 5 एलिमेंट हैं, तो हर एक 5 एलिमेंट में एक स्पेसिफिक इमोशन है जो उसको डोमिनेट करता है. फॉर एग्जाम्पल, I'll give you a brief at the end. I am just trying to explain you so that you can have a connection कि आपकी बॉडी के 5 एलिमेंट्स आपकी बॉडी की फिजियोलॉजिकल एक्टिविटीज के साथ में कैसे कनेक्टेड है. इमोशंस का मतलब है कि हर एक एलिमेंट का जो इमोशन है, फॉर एग्जाम्पल द हैप्पीनेस, द जॉय इज रिलेटेड विद फायर, विच इज रिलेटेड विद द हार्ट एलिमेंट. अभी हमारी बॉडी के जितने भी हैप्पीनेस मोमेंट हैं या जॉयफुल मोमेंट हैं, वो सारे आपके फायर एलिमेंट के साथ में कनेक्टेड हैं. जितने भी आपकी बॉडी का ओवर थिंकिंग है, राइट, व्हेन यू आर टॉकिंग अबाउट मोर ऑफ, when a person is more tend to give so much thought on any one thing, that is related with the earth element or that is related with the spleen organ. The next emotion can be crying, or the next emotion can be grief, or you can say that it's in Hindi we call it as dukha, right? वो आपके मेटल एलिमेंट के साथ में कनेक्टेड है. जब हम एक इमोशन की बात करते हैं जो है डर, फियर, वो इमोशन जो है वो हमारा वाटर एलिमेंट के साथ में कनेक्टेड है. सेम वे जब हम सबसे इम्पोर्टेंट विच इज लाइक नाउअडेज इट्स मोर इनटू ट्रेंड, दैट इज नोन एज एंगर, राइट, जो हमारा गुस्सा है, जो हमारी इरिटेशन है, फ्रस्ट्रेशन है, वो हमारी वुड एलिमेंट के साथ में कनेक्ट करती है, लिवर के साथ में कनेक्ट करती है. ऐसे ही जब हम अपने इमोशंस के बारे में बात करें, when a person comes as a patient, when or anybody in your family or yourself, when you feel a certain emotion which is at the highest peak, और बहुत बार ये रहता है कि हमारा एक पर्टिकुलर इमोशन रहता है एक पर्टिकुलर टाइम पे जो हम रहेगा, राइट. That dominancy explains about that particular organ or that particular element which is at max. अगर हम हेल्थ के बारे में बात करें तो वो जो हेल्थ है वो हमेशा आपको ये बताती है कि इन पांचों ऑर्गन्स का, इन पांचों इमोशंस का एक बैलेंस बने रहना जरूरी है. बट इफ इन केस जैसे ही वो बैलेंस बिगड़ता है, जैसे ही एक पर्टिकुलर इमोशन ज्यादा हावी हो जाता है, दैट प्रेजेंट्स द डिजीज और दैट प्रेजेंट्स द इम्बैलेंस बिटवीन दोज एलिमेंट्स. ऐसे ही हमारे पास डिफरेंट कलर्स हैं, डिफरेंट सीजन्स हैं जो डिपेंड करते हैं पांचों एलिमेंट्स पे. जैसे अगर हम देखें कि जो पांचों कलर्स हैं, जो पांचों एलिमेंट्स के, वो डिपेंड करते हैं कि आपकी बॉडी में उस कलर की रिप्रेजेंटेशन क्या होगी. जैसे द कलर रेड रिप्रेजेंट्स फायर. सो व्हेनेवर एनीवेयर यू सी इन्फ्लेमेशन, जब भी आपको दिखाई देता है कि कहीं पे स्वेलिंग है, कहीं पे इन्फ्लेमेशन है, कहीं पे बॉडी रेड है, कहीं पे रैशेज आ गए हैं, या फिर when you see that the face is becoming red or the fleshy experience is there or fleshy symptoms are there, that is related with the fire element, which represents that there is an imbalance of a fire element. Next thing comes as if you talk about, let's say, earth element, uska jo color hai that is related with brown, right? Now what is exactly the brown color? You can say about it's a color of a mud, it's a color of earth, right? तो जब भी आपकी बॉडी में जनरली एलिमेंट जो है वो हमारे फीसेस में नोट किया जाता है, that what is the color of the stool, and with the you can say the perspective of that color you can get to know कि हमारा कौन सा एलिमेंट जो है वो इन्वॉल्व है और कैसे वो जो फीसेस हैं या कैसे वो जो स्टूल हैं, what going wrong in the food which is going into the stomach and that is causing the problem in the stool. नेक्स्ट जो कलर है वो है हमारा मेटल एलिमेंट का, जो कि कलर है व्हाइट. तो व्हाइट जनरली कलर हम नोट करते हैं अगर मान लीजिए इम्बैलेंस है हमारे मेटल एलिमेंट में, तो व्हाइट कलर दिखेगा हमारी एक्सपेक्टोरेशन में, कफ में, फ्लेम में, और या फिर देयर कैन बी अ व्हाइट स्पॉट्स इन द होल बॉडी. नेक्स्ट कलर कम्स इज वाटर, और द कलर रिप्रेजेंट्स हमारा वाटर एलिमेंट, दैट इज ब्लैक. तो हमारी बॉडी में जो वाटर एलिमेंट है या जो किडनी ऑर्गन है वो बहुत ज्यादा इंपॉर्टेंट है इन टर्म्स ऑफ हार्मोनल लेवल्स, इन टर्म्स ऑफ एंडोक्राइन सिस्टम. तो हमारी बॉडी के इन केस ऑफ एनी काइंड ऑफ प्रॉब्लम विच इज रिलेटेड विद द हार्मोनल इश्यूज, इन सच केसेस हमारा जो वाटर एलिमेंट है दैट इज इन्वॉल्व. एंड इन केस अगर वाटर एलिमेंट इन्वॉल्व है तो हाइपर पिगमेंटेशन ऑफ अ ब्लैक कलर या फिर काले रंग के मतलब स्पॉट्स पड़ना बॉडी पे, या फिर आप देख सकते हो कि मेनी पीपल हु कम्स with hypothyroidism, hyperthyroidism, PCOD, PCOS, infertility, they have a black discoloration at the nape of the neck or at the knuckles, or people who have a kidney disorders, let's say chronic kidney failure or even an increase in uric acid level. Every people, those have a black representation of color on their body as well as on their joints. And the next last color, which represents our wood element, that is related with green. And that green color generally again comes with the stool. It can also come with the bile. It can also come with the body fluid which can be excreted out from the body. तो हर जो एलिमेंट है वो एक स्पेसिफिक ऑर्गन के साथ में कनेक्टेड है, वो एक स्पेसिफिक कलर के साथ में कनेक्टेड है, सेम वे वो एक स्पेसिफिक सीजन और टेस्ट के साथ में भी कनेक्टेड है. अगर मान लीजिए कोई भी पेशेंट हमारे पास आता है जो ये रिप्रेजेंट करता है कि उनके पास एक जो डिस्कम्फर्ट है, जो डिजीज है, या फिर जो भी उनके प्रॉब्लम्स हैं हेल्थ रिलेटेड, वो एक पर्टिकुलर ऑर्गन के साथ, इमोशन के साथ, सीजन के साथ, कलर के साथ या फ्लेवर के साथ कनेक्टेड है, तो वो हमें एक आइडिया देते हैं कि कैसे उन 5 एलिमेंट्स में से कौन सा एलिमेंट है जो इम्बैलेंस्ड है. उसके बाद में ऑल्सो दीज एलिमेंट्स इन्फ्लुएंस आवर फिजियोलॉजी, पैथोलॉजी. एंड अगर मान लीजिए फिजियोलॉजी, एज आई टोल्ड यू, देयर आर 2 साइकिल्स, वो आपको फिजियोलॉजी रिप्रेजेंट करेगा. देन जो दूसरे 2 साइकिल हैं, ओवर एक्टिंग साइकिल एंड इंसल्टिंग साइकिल, वो आपकी पैथोलॉजी इन्फ्लुएंस करेगा. और जैसे ही हमें ये पता चलता है कि 2 साइकिल्स में से कौन सा साइकिल इन्वॉल्व है, उससे हमारी जो ट्रीटमेंट स्ट्रेटेजीज हैं वो प्लान होती है. ठीक है, अभी जस्ट इट्स जस्ट एन एग्जाम्पल टू मेक यू अंडरस्टैंड बेटर. जस्ट इमेजिन कीजिए कि ये जो सारे एलिमेंट्स हैं वो एक ही कंपनी के लिए काम करते हैं, राइट? एंड द कंपनी इज कॉल्ड एज हेल्थ. ठीक है, अब हर कंपनी का या फिर हर आप बोल सकते हो डिपार्टमेंट का अलग अलग काम है. अगर मान लीजिए मैं एक इंस्टीट्यूट की बात करूं, वहां पे जो आपका HR डिपार्टमेंट होगा उसका अलग काम होगा, एडमिन डिपार्टमेंट होगा उसका अलग काम होगा, क्लिनिकल डिपार्टमेंट होगा उसका अलग काम होगा, एकेडमिक डिपार्टमेंट होगा उसका अलग काम होगा. तो एक इंस्टीट्यूट में अगर आपके पास बहुत सारे डिपार्टमेंट्स हैं, तो ये एलिमेंट्स जो हैं ये उस डिपार्टमेंट के HODs हैं. ठीक है, जो हेल्थ के लिए काम करते हैं. अब until unless all these departments are not well equipped with energy or not well equipped with their functions, तब तक हेल्थ प्रोवाइड नहीं की जा सकती है, तब तक हेल्थ नहीं अटेन की जा सकती. ठीक है, तो इन 5 एलिमेंट्स में जब हम बात करते हैं, इट हैज टू बी वेरी श्योर दैट ये 5 एलिमेंट्स का बैलेंस्ड एंड इक्वल होना बहुत जरूरी है अगर हमें हेल्थ पर्सपेक्टिव से बात करनी है या अगर हमें किसी को भी हेल्थ प्रोवाइड करनी है. अब हम बात करेंगे एक एक एलिमेंट का. सबसे पहले हम विल टॉक अबाउट वुड एलिमेंट. इसके पास 2 ऑर्गन्स हैं, लिवर एंड गॉल ब्लैडर. ये जो लिवर और गॉल ब्लैडर है, इनका वेरी बेसिक फंक्शन जो है, फर्स्ट वन इज दैट इज रीजनरेशन एंड रिपेयरिंग. हमारी पूरी बॉडी में पूरे दिन में, वेदर इट इज बिकॉज ऑफ फिजिकल एक्टिविटी, मेंटल एक्टिविटी, या फिर वेदर इट इज बिकॉज ऑफ एनी एक्सर्शन, जो भी वेयर एंड टेयर मैकेनिज्म सुबह से लेकर रात तक होता है, द वेरी फर्स्ट फंक्शन ऑफ लिवर एंड गॉल ब्लैडर इज टू रीजनरेट दैट. ओके, so that the next day when we get up, it's a new day. It's a new day with a full form of energy so that we can complete our other tasks, whatever is assigned. तो पहला फंक्शन जो है हमारा लिवर और गॉल ब्लैडर का, वो है कि हमको ग्रोथ और हमारी जो रीजनरेशन है ऑन द बेसिस ऑफ एवरीडेज लाइफस्टाइल, दैट इज टेकन केयर बाय वुड एलिमेंट. बेसिकली अगर आप देखोगे कि कौन कौन सी चीजें लिवर और गॉल ब्लैडर रिस्पॉन्सिबल है हमारी बॉडी में, द वेरी फर्स्ट वन इज ग्रोथ. Okay, so any case related with growth development, any case related with developmental delay, any case which is related if you are getting getting the cases between who are lesser than the 8 years of old and then they are coming to you, जिनके milestones जो हैं वो they are not as simple or they are not as usual as other child, yes, their liver and gallbladder is affected. Next, it is associated with flexibility, as association of liver and gallbladder is also with the tendons as well as with the ligaments. तो जितने पास cases हैं clinical perspective से जो हम treat कर रहे हैं pain management के लिए, when it comes to their tendons and ligaments, again their liver and gallbladder is affected. Next, when we are talking about movement, liver, it has the very function of that it stores the blood and also it takes care of the regulation of free flow of chi. तो अगर मान लीजिए कोई भी मूवमेंट है या कोई भी अगर आप बोलो कि फंक्शन है जो प्रॉपरली रेगुलेट नहीं हो रहा, तो या फिर कहीं पे भी स्टैग्नेशन है या कहीं पे भी कोई चीज जो है वो रेगुलेशन ऑफ ची में डिफरेंस आ रहा है या रेगुलेशन ऑफ ची प्रॉपरली नहीं हो रही, इन सच केसेस आर लिवर एंड गॉल ब्लैडर इज अफेक्टेड. नेक्स्ट वी हैव द सीजन, लाइक जैसे मैंने बोला कि हमारे पास अलग अलग कलर हैं, हमारे पास अलग अलग ऑर्गन्स हैं, हमारे पास अलग अलग फ्लेवर्स हैं. तो जो सीजन जो वुड एलिमेंट को रिप्रेजेंट करता है वो है स्प्रिंग. एंड हमारा जो बेसिक फंक्शन है, एज आई टोल्ड यू, द लिवर ऑर्गन का जो मेन फंक्शन है वो ब्लड स्टोर करके ची को रेगुलेट करता है. एंड जो हमारा गॉल ब्लैडर एलिमेंट है या गॉल ब्लैडर ऑर्गन है, उसका मेजर फंक्शन है डिसीजन मेकिंग. Okay, so anybody who has struggling or who struggles with decision making, we can easily find out that they have an imbalance of this particular element known as wood element, or with the imbalance of liver and gallbladder. Now, I guess this disease and also this study was already taken into consideration by Dr. Gayatri. She has taken in her presentation. It is from 2018. It is that the role of a stress in liver diseases. Okay, it's a journal of hepatology, interactive medicine journal, which was done in 2018. This study had showed that liver function and stress, they both are related with each other. Any person who is diagnosed with liver chi stagnation has higher amount of cortisols comparatively to a person who is having a liver chi good flow of energy. Okay, so any like if we have a patient which is related with the stress, which is related with anger issues, which are related with any psychosomatic disorders, in such cases the liver chi stagnation is very common. And if in case the liver chi stagnation is there, the cortisol amount in their body is much more higher than the other person. Now, what can be done if anybody gets the imbalance between the wood element? As an acupuncturist, other than the pricking or other than the needling, what exactly we are supposed to do for that particular patient? As we all know, the cortisol levels are responsible for the sympathetic nervous system to be switched on. And to the opposite of it, if any sympathetic nervous system is regulated, or if the sympathetic nervous system is working, the very first function as yoga practitioners, as a naturopathy practitioners, or as acupuncturist practitioners, that we have to make sure that that particular person is having a parasympathetic nervous system activation. And deep breathing is the best example for parasympathetic nervous system activation. So along with your needling, along with the acupuncture, along with the diet therapy, we also have to make sure that the person is undergoing with the parasympathetic nervous system activation, so that the amount of cortisol level comes down, as well as whenever there is a cortisol level drop, or whenever the cortisol level comes down, automatically the growth, the flexibility, the movement, and the emotion related to anger will also come down, and there will be increase in the storage of the blood. And also there will be the struggle of making the decision will also be resolved. And we also need to understand as acupuncturists that whatever patient tells, right, it's not their habit, it's their symptoms. If a patient says that I get very angry, it's not their habit or it's not their nature, it is their symptom. So I always say, for a clinical practice, whenever you're talking to an acupuncturist, even if you get irritated or you get too happy, the acupuncturist will always look at you with the eye of a symptom. They will not look at you with this saying that, okay, this person is very good in nature, this person is very cranky in nature. No, we all talk about an imbalance in elements whenever we meet a new person. The next element we have, that is wood element. And this particular wood, the next element we have, that is fire element. The organs which are related with these element, that is heart and small intestine. Now, when we are talking about heart and small intestine, as I told you, the emotion which is related with that is happiness, joy. Anybody who gets happy when they hear a good news, it's normal, right? But many people you might have seen in your clinical, OPDs or in your everyday life, there are few people who have the level of happiness is little bit much more higher, even for a very small reason, or even for a very small news, or even for a very basic information. That generally represents that the organs or the magnitude of chi is imbalanced in heart and small intestine. When we are talking about the function, when we are talking about what are the characteristics of a fire element, it takes care of blood circulation, it commands blood flow. Okay, fire element is responsible for the blood has to flow where, which artery is going to get the blood flow, how much blood flow has to go in that particular artery. That is what our heart does. And the season which it represents, that is summer. So if any patient comes to you who says that, or if any person comes to you who says that my particular emotions or my particular symptoms gets aggravated only when the summer starts, that also tells us that there is a problem, or there is the imbalance between a particular element known as fire. And the very another very basic function of our fire element, which is related with our everyday life, that is it takes care of the mind. Okay, heart houses the mind. So if in case we have the more confusions, there are people who will be always confused, there are people who will be absent minded, you can say that, or otherwise they say I was never like this, but now I got to know that I get confused very easily. So that we generally say that phlegm can houses the mind, and phlegm is generally happens because of the dampness. Okay, so heart is taking care of the circulation, and it also takes care of the mind. So any kind of mental problem when it comes to somatic or psychiatric problems, in such cases taking care of a chi between heart and small intestine is very important. The very basic function of small intestine, as all other yang organ modern physiology functions, it takes care of the digestion, but also, as I told, it takes care of the mind. So the connection between heart and small intestine is also responsible for the clarity. Next, this is a 2012 study which explains about that the human body, whenever you have any emotional up and down, okay, any emotional regulation is also changing the HRV, that is your heart rate variability. Now, which represents your heart health. For example, anybody who is having the imbalance of fire element, if you tell them a good news, or if you tell them a happy news, their HRV is going to show a different disease, or different results. Whereas to a normal human body, if you say the same news or if you say the same information, their HRV might not be that variable. Okay, so that shows that the emotional regulation is directly proportional to HRV, and also it tells you about the heart health. Now, as we all know, if the emotions are into place, right, in yoga, or even you can say in our daily activity, meditation helps really well. Meditation will take care that, or meditation will make sure that your emotional balance is made, or you are not focusing on one emotion for a longer period of time, and your all the emotions related to all the 5 elements, whether it is anger, whether it is joy, whether it is overthinking, whether it is grief, all the emotions are into into balance. Now, one more thing which we all have to understand is that everything is related, every organ is related with one organ, every emotion is related with one element, but all the emotions are related with fire element. Okay, so even though anger is representing the wood, overthinking is representing the earth, but anger and overthinking is also taken care by the fire element, because that is where the emotional balance comes. Now, when we're talking about, every slide will have one fun fact. This fun fact is if in case anybody who is having the fire element imbalance, okay, love and laughter is the very basic thing which will make sure that the fire element is balanced. So any person who comes to you who has emotional imbalance, make sure that in your complete treatment protocol, right, there is one recreational activity where you are prescribing them to force them to do that which causes love and laughter, whether it can be a laughing meditation, whether it can be a laughing therapy, it can be anything, but that will heal the fire element. The next organ or the next element comes as earth element, which is of spleen and stomach. And as I told you, the very basic function of earth element is that it provides nourishment. It's like you put a seed, it will give you a tree. Okay. And the season related to earth element, that is late summer. And late summer is basically which the months of the year which comes after summer. Okay. As we know, the fire element is taking care of the summer season, but after the 2 months of that summer season is related to late summer, and the emotion which is related to that is worry, or you can also talk it about overthinking. The basic function of spleen is to convert the food, whatever the stomach is taking. Stomach will receive the food, it will process, it will change the food into food chi, and the very basic function of spleen is to make sure that that food chi has to be transported and transformed into the lungs. That's the basic function. Okay. Now here, if you see the scientific insight, it's a 2019 study which explains about that the microbiome gut-brain axis in health and disease. Okay, as I told you, that your gut and brain, they both are related with each other. And in fire element or in 5 element in TCM, we don't talk about brain much, right? Because we take spleen as the brain. So here, when we are talking about gut microbiome axis, that is what it takes care about TCM's earth element principles, where in modern physiology we talk about brain and gut, how they are related to each other, but in TCM we talk about how spleen and food or spleen and digestion are related to each other. So the basic function of spleen is it takes the energy from the stomach. Okay, after taking the energy from the stomach, it converts into a food chi, and that particular food chi is transformed to lungs and only to lungs, so that can be made the other form of cheese further. Now, if anybody who has the spleen and stomach imbalance or the earth element imbalance, what are we going to do, right? The very first thing, as we all know, gut and brain axis are connected with each other. The connection is really strong when it comes to a TCM perspective. We have to make sure that there should not be any other distraction when they are having the food or anything when they are putting inside their stomach. They have to do the mindful eating exercise. Okay. Another thing, how we get to know that the earth element is affected, sweet cravings will let you know or will indicate that there is an imbalance. There are many people on an everyday basis, we all come across, who says, I love sweets. I like sweets. I cannot stay without sweets. I can eat sweets how much ever I want. So again, as acupuncturists, that is not their liking, that is a symptom. Next element come as metal element. The organs related are large intestine and lungs. And the very basic function of lung is, as I told, that lung receives the energy or food chi from spleen, and also lung is responsible for the formation of chi. Okay. There are 3 types of chis. You have food chi. I hope all of you know we have food chi, we have water chi, we have air chi. The combination of these 3 chis along with the essence will make a true chi, which is what present in all the meridians, right? And the lung function is, जो lung का basic function है, वो ये है कि वो जो particular chi है, जो true chi है, वो सभी organs में, सभी meridians में उसको equally amount में distribute करना is what lungs function is. And the emotion जो इसके साथ में connected है वो है grief, and जो season है वो है autumn. There are many if I give you a very basic example of metal element involvement, any person who is coming to you with the problem related to eczema, psoriasis, any kind of skin diseases, acne vulgaris, any kind of problem which is connected with either the digestion or with the skin, they will always say that whenever the autumn comes or whenever this particular season comes, the itching aggravates. Or whenever the winter comes, the itching aggravates, right? That is what you can say. It's a sign where you can find out that there is a imbalance between the metal element. Now, as we all know, lung is also responsible for respiration and breathing, right? And the skin and respiratory system is connected with each other. If any person who is you are treating for the point called as skin issue, you have to make sure that the lung chi is really good, and you have to make sure that the person is under pranayamas, and you also have to understand that any people who has a strong metal element, right, their nose is going to be very strong. Okay, the last element we have, that is water element, and the season is winter and the emotion is fear. And the organs which are related, that is kidney and urinary bladder, which is very, very important element, because this is particularly going to tell you about how much your body will be able to do the stress adaptation. Okay, there is also a scientific study of 2007 which says that if you are more stressed, if you are more fearful, your kidney will age more faster. Okay, and the very first, you can say that how to treat that particular water element, that you have to make sure that the energy flow has to be done by exercise. Movement is very important. Adaptation is very important. Flexibility is very important. So any person who is having the water imbalance will have that kind of fear in the body, which was not manifested when it came inside when the patient felt the fear, it was not acknowledged enough that it has manifested inside the body, which is causing the water element imbalance. So this would be my second last slide, and that is the health is maintained when all the elements are balanced. We have talked about all 5 elements. We talked about what are their seasons, what are their elements, what are their organs. But what is health now, right? So it's like, it is, as I told you, the health is maintained only when all the elements are balanced. And if in case any time the imbalance comes, that can lead to the specific disease. Okay. Now, the very interesting thought is, in your body, which element do you think that is imbalanced? Whatever we have talked about today regarding their seasons, their metals, their elements, everything, I want all of you to just give a thought, or take any one patient and give a thought that which element do you resonate with the most. And these are the few points, acupuncture points, which we are using on our everyday basis in our clinical practice. These are also known as command points. And command points are basically nothing but it's related to that which organ will get stimulated by which element and by pricking which particular point. Like, for example, if anybody is having a lung disease, or which anybody is having a skin disease, and according to the physiological perspective, if we get to know that there is an imbalance between a mother and son-in-law theory, it simply means that the metal element is not getting a good enough energy from earth. तो अगर एक सन को मदर से अच्छे से एनर्जी नहीं मिल रहा है, इन सच केसेस दीज पॉइंट्स विल बी यूज्ड कि हम अर्थ पॉइंट जो है मेटल का वो हम प्रिक करते हैं. देयर आर मेनी अदर प्रोटोकॉल्स, बट दिस इज जस्ट फॉर योर you can say that for a quick takeaway कि आपको whenever you are talking about this acupuncture and 5 elements, these are the command points which we generally use in our clinical practice. These are one of the primary points. There are many other protocols which we are using. So this would be my last slide. Then 5 elements, how they are working, what and all the researches are yet to be done, what and all the practical applications along with the lifestyle, diet and emotional well-being has to be done. Okay, and how the TCM insights can be used for the healthier lifestyle. And that would be your question, or you can say that that would be a takeaway for all of you, to give a thought about that. How can you bring balance to your own element? As I told you in the last to last slide, that which element do you resonate the most, and whichever element came into your mind at that time, now the next question would be how you will be balancing that particular element. Okay, so this is just a brief. What and all organs, what and all colors, what and all yang organs, what and all their tastes, tissues, seasons where they will be mostly activated, what are their emotions related. Okay, so thank you so much. I am really grateful to have all of you as an audience, and then I'm really grateful for SB Pass and Dr. A.K. Jain to call me, and I hope I have finished on time. And thank you so much. If you have any questions, please, they are welcomed. Thank you.
Thank you very much, ma'am. Thank you very much, ma'am, for the nicely explain the concept of the 5 elements theory. Elements, emotions, nature, each and everything you have also covered. Thank you very much. So many questions may be, but in the mind, after the few minutes, we can again give to mic in the Dr. Kajal Gupta ma'am, because we are invited to our respected Professor Dr. P.B. Lohia sir with us. So I invited Mrs. Preeti Jain madam for the introduction of the Guruji, respected Professor Dr. P.B. Lohia sir.
Namaste. Good afternoon to all. I am feeling very blessed and honored to introduce such a great personality. He is called Father of Acupuncture in India, Professor Shri P.B. Lohia sir. He is chairman and founder of Indian Academy of Acupuncture Science, Dean Huang Di Nizing Research Center, visiting professor for Beijing Meridian Research Center in China, and Professor Emeritus for Medicina Alternativa Sri Lanka, basically an allopath, considering the limitation of modern medicine, particularly in curing chronic diseases, started a research for an alternative and found the answer in form of acupuncture. He visited China, Hong Kong, Sri Lanka, Spain, UK, Swiss, and many other countries to master the art of acupuncture. As a visiting professor, he traveled all over the world to deliver lectures and to present his research paper in various international conferences. Received many international and national and international accolades, gold medal of honor, and married by Medicina Alternativa International, the best acupuncture teacher award by the International Academy, shield for excellence from Academy of Pakistan, and certificate of excellence from the Open International University, Colombo. He has been awarded the Physician of the Country International Accolade, Albert Schweitzer International Award, and Pauli International Accolade. He has also been awarded World Famous Doctor International Award in China. Polish Mother Memorial Hospital, Poland, has honored him with the title Honorable Friend of the Institute, while he was awarded Corso o Merito in Italy. PhD for his research paper on auditory disorder in Spain. Published many research papers and authored many books. He research paper co-authored by Professor Dr. Lohia and Dr. Swati Lohia on how to live 100 years old. Received a special award in the international conference held at Beijing, China in October 1995. He has been appointed as Vice Chairman of World Association of Traditional Chinese Medicine, China, and Chairman of its Indian branch. He has trained over 5,000 doctors in acupuncture and quite a many of acupressure and cosmetic acupressure. He regularly conducts free consultation camps throughout the country. By October 2020, about 30 lakhs patients have been consulted at Dr. Lohiya's Acupressure Center, Aurangabad, and its branches throughout India. Thank you for giving me this opportunity to introduce Professor Lohiya, sir. Thank you so much.
Thank you, Preeti ji. Welcome, sir. Pranam, Guruji.
Hello. I hope you can hear me.
Yes, sir.
I'm Professor Dr. Lohiya, Chairman of Indian Academy of Acupuncture Science. On behalf of our academy, I welcome all of you, all the guests who are attending this conference. This century is century of drugless therapies. Myself, I am a doctor of allopathy. I practice allopathy successfully for 10 years. I was running maternity surgical home, and then I left allopathy and switched over to acupuncture. Everybody asked me, why did I leave allopathy? Allopathy is a good science, but in allopathy, we don't know the root cause of about 90% disorders. That is the problem. So we keep on giving drugs and suppressing symptoms temporarily. So I was not happy in allopathy because it is temporary. In drugless therapies like acupuncture, if one is an expert, we can find out the root cause of the problem based on 5 elements, and then we can try to cure the element. This is first advantage. Secondly, in allopathy, we are giving chemicals, and we all know that chemicals, they can damage liver and kidney. Chemicals are filtered in kidney and metabolized in liver, so the so-called side effects are because basically if kidney is damaged, it has effect on sex organs, ear, etc. Many problems, bones and cartilages. And if the side effect is on liver, it may damage optic nerve, it may damage retina, many complications. In drugless therapies, because there is no drug, there are no side effects or complications. And most important and last is India is a developing country. Majority population of our country is below the poverty line. And unfortunately, in modern medicine, most of the income of these middle class people, low class people is spent on these costly drugs. Endless therapies like acupuncture, naturopathy, yoga, etc., etc. Because these expenses can be saved. And in acupuncture, there is one more advantage. For minor ailments, we can advise self-acupressure to our patients. By now, I have conducted more than 1,500 lectures throughout the country to teach people how they can treat themselves with acupressure for common minor ailments. So, uh, Dr. Antim Jain is not only my student, he is a versatile personality. He has been trying his most to popularize drugless therapy throughout the country by conducting such seminars and conferences. I wish him all the success. I congratulate him for this successful conference. I welcome again all of you and thank you very much. Bye bye.
Thank you very much, sir. Thank you, sir. हमारे साथ में डॉक्टर योगेश कोटकानी सर भी हैं, मैं उनका भी स्वागत करता हूं. And myself is my pleasure to I am a student of the Dr. P.B. Lohiya sir. It's my pleasure. अभी हमारे साथ और भी बहुत से स्टूडेंट्स हैं, उनके मन में 5 एलिमेंट थ्योरी को लेकर कुछ होंगे. Part of the question answer session. If you have any questions related to 5 element, please hand raise. Any questions? Any words? No question. Maybe more study, more confusion. No. Okay. Kavita ji, please unmute yourself. आपका कोई क्वेश्चन प्लीज? प्रशांत सिंह जी, प्लीज अनम्यूट.
नमस्ते सर. क्वेश्चन है कि ना मैम ने इमोशन से रिलेटेड किया 5 एलिमेंट को, पेन से भी सारे रिलेट कर सकते हैं क्या? सारे एलिमेंट पेन्स अलग अलग टाइप्स के होते हैं ना.
जब हम पेन के बारे में बात करते हैं, पेन अगर हम देखें टीसीएम में या टीसीएम पर्सपेक्टिव से, पेन है एक स्टैग्नेशन. जब भी किसी एलिमेंट में, जब भी किसी पर्टिकुलर मेरिडियन में कोई भी जो ची है, जो हमारी वाइग्नेट कर जाता है, जब भी फ्री फ्लो ऑफ ची नहीं होता, दैट कॉजेज पेन। बट वो डिपेंड करता है कि वो सिर्फ स्टैग्नेशन की वजह से है। अगर तो स्टैग्नेशन है या अगर फ्री फ्लो ऑफ ची नहीं हो रहा, दैट इज कंप्लीटली रिलेटेड विद लिवर एंड गॉल ब्लैडर, एज आई टोल्ड यू दैट the very first basic function of free flow of chi is of for liver and gallbladder. But if in case अगर जो chi stagnation एक particular element में है या एक particular meridian में है, in such cases needling can help, and then you can मेक श्योर दैट कि वो जो आपका पर्टिकुलर जिस भी पॉइंट पे स्टैग्नेशन है, अगर आप उस पे नीडलिंग थेरेपी देकर, मॉक्सिपिशन देकर, कपिंग थेरेपी देकर अगर वो आप स्टैग्नेशन रिमूव करेंगे, ऑटोमेटिकली वो जो पेन है वो कंप्लीटली चला जाएगा, या मतलब लाइक रिजॉल्व हो जाएगा। I hope I answered your question.
Anyone? A. Rahul, please unmute yourself.
Yes, ma'am.
I had a query. What about carcinomas patients? वो तो इसमें तो सेल एक्टिविटी जो है डिस्टर्ब हो जाती है, तो ऐसे केस में आप क्या कहना चाहोगे कि इसमें एलिमेंट डिस्टर्बेंस, कौन-कौन से एलिमेंट्स आर डिस्टर्ब्ड एंड हाउ यू treat it?
See, whenever we are talking about a systemic inflammation, or whenever we are talking about a cell differentiation, or let's say oncology cases, in such cases it is never that only one single element is involved. Whenever the systemic problem is there, or you can say that the lifestyle disorder, or when we are talking about cancer, we have to make sure that, or we have to understand that what is the cause of that particular thing, right? Of course, the cancer cannot come in a day. It cannot come, or it has to be predisposed in the body for a longer period of time. So by taking a case history, by talking to a patient, we need to understand that what exactly is the cause. And of course, as you said that it is a cell differentiation matter, you cannot just treat it by treating one element. We have to take it as whole. We have to make sure that all the elements, we are making sure that the magnitude of chi is good. So it's not one element involved, it's the complete 5 elements imbalances there which has caused the problem. Yes, Kavita ji, you can unmute yourself. Yeah.
Yes, ma'am. It was very nice lecture. मैम, मेरा एक ही क्वेरी है कि इतने पेशेंट आते हैं, इवन मैं खुद पेशेंट हूँ, एक एलर्जी को लेके समझ में नहीं आता कि कौन सा एक ऑर्गन डिस्टर्ब है या ओवरऑल किसको ट्रीट करना चाहिए। जैसे एलर्जी की बहुत पेशेंट है आजकल, एंड थ्रू आउट द ईयर भी रहती है वो, ऐसा नहीं कि रेनी सीजन में हो रही है, बट वो थ्रू आउट द ईयर रहती है। तो
जब हम एलर्जी के बारे में बात करते हैं ना, एलर्जी बहुत ही, यू कैन से दैट it's a vast term.
Exactly.
Right? Now, allergy can be related with lungs, allergy can be related with nose, it can be related with, like सब elements उसमें involve हो सकते हैं. But अब वो कौन सा patient आपके पास आ रहा है and what type of allergy they have, that everything you get to know only by taking a case history. Like, for example, if anybody comes to you who says that I only have a sinusitis, or I have only problem related with allergic rhinitis, okay, or otherwise I have only running nose, nothing else is there. In such cases, okay, if they don't have any predisposing factors or associating factors, it is easy to understand that only 1 or 2 elements will be involved. And that is how we get to know that out of those 4 cycles, which cycle is involved. Right? So when we are talking about the TCM diagnosis, understanding those 4 cycles are very important. And most of the time when patient comes to you, patient will never come to you with one symptom involved or with one organ involved. They will come to you when there are many. So understand how the progression of the disease has happened, and that way will let you, you will get to know that which organ is involved. And when a patient comes, it's not about that at that time which organ is involved. It's more about how it has started. Okay, so you need to treat the root cause. You need not to treat the symptom at that point when patient has come to you.
Thank you, ma'am. Thank you. Now I invite Dr. Yogesh Kotkani sir for the concluding the whole session. और सर को इनवाइट करने से पहले सर का छोटा सा परिचय दे दो. Sir is a very simplest person, but he is also allopathy medical practitioner. He's acupuncture practitioner. He's a teacher of the Maharashtra Acupuncture Council, and he is also so many expertise. बहुत सारी expertise सर की ऐसी है जो मैं नहीं बता सकता हूँ, लेकिन सर is a very artistic person. तो मैं सर को पूरे सेशन को कंक्लूड करने के लिए आमंत्रित करता हूँ एसबी पास की ओर से, सभी और जितने भी इंस्टीट्यूशन हमारे साथ में एसोसिएट थे उन सब की ओर से प्लीज डॉक्टर योगेश कोटकानी सर, वेलकम सर.
Thank you, Antim ji. Thank you for calling me to give the Antim summary of this conference. So I'm very, very happy to be associated with you, and you are always trying to show your love and honor, and I'm very much grateful to you for that. So this was a most wonderful conference that I have witnessed last 2 days, and today my job is to give a summary of the 4. Otherwise, yesterday's speakers were also excellent, and they have already been summarized. So I will just restrict myself to the speakers of today. I'm very grateful to Dr. Sahil Kapoor that he has drawn our attention to this very important subject of divergent. And somehow we have not been told about its importance. And today he has told us how important they are, how they work on all the 3 levels. We need to do a good study of this topic. His introduction was excellent. It has generated a deep desire to study this. So people who want to really study this, of course, Dr. Antim Jain, if he arranges some lecture on this, is most wonderful. Otherwise, till then, we can read the books of Masioka Giovanni. They give details of this. So of sciatica, otherwise normally people tend to remove this inflammation, but he has also given us a deeper insight which says that it's not just the nerve, but it's also, you have to understand that it can be due to deficiency of chi of the kidney. It can be also due to the deficiency of imbalance in the pelvis and other things, which can be treated by treating other meridians of acupuncture. So this is a very important understanding which he has given. And I hope this helps people to treat the sciatica problem better. Then we had Miss Gayatri, and she has again brought our attention back to a very important subject. Again, many people, once they mostly start with reflexology, then they turn to the main basis of acupressure of Chinese TCM, then acupuncture, and then they tend to forget that reflexology is also very effective science. Personally, I had a very good experience once because I don't practice reflexology. I practice only acupuncture nowadays, not even acupressure. But there was a case where I found that reflexology was the only treatment that could work, and I did it, and it had wonderful results. So I had a patient whose son was admitted in the ICU in US, and for a problem which the doctors over there in the ICU also, they were not able to diagnose. He was having consistent vomiting and diarrhea, and he was not able to eat anything. So I took his history, how it started and all, and I could diagnose that it was a case of intersusception of the intestine. It means that the small intestine, it has rolled itself, it has somehow got into itself. It's like a tube that has been pushed into itself. So in this case, not only was, even if the patient had been in Mumbai in front of me, I would have done not acupuncture or acupressure, but reflexology. So I told his mother what to do, what point, and how to massage that point on the sole. And she went to US in the ICU. She did that, and within 1 day, that person was cured. He was out of the ICU, and that's it. That was the end. Otherwise, they were going to cut open his body, do laparotomy, and try to see what the problem is. So not only this shows us how important such a simple technique like reflexology can be if you know when and how to use it. And otherwise, Miss Gayatri has shown us through scientific studies how effective it is in having actually chemical changes within the body. So let us also not forget this important science of reflexology and use it whenever and wherever we feel that it is very important. Because it's a little more time consuming compared to acupuncture, we tend to neglect it. But at times we should have the best of the patient in our interest, best interest of the patient. So we should use this science also wherever required. And finally, we had Dr. Kajal, who has again touched upon the very most important science of 5 elements. And I must say that this 5 element theory, in fact, I have expanded it to the 8 element theory by adding the other elements like mind, intelligence, and ego. And I'm using this as the basic system in my practice. And it's the most important way to deal with things. Of course, TCM teaches us many other ways, which are also important in certain conditions. But when it comes to chronic conditions, there is nothing like treating on the 5 element basis. Now, she has also given us the importance of the gut-brain axis and how this axis actually works with the spleen. So this was also a very good insight. And she has also explained about the emotions and about the colors. And on the whole, this has been a very, very wonderful exercise of the whole idea of explaining the importance of 5 elements in acupuncture, in healing, and how it is a multidimensional thing, not just related to acupuncture, but also the field of emotions and color. So I'm very happy to have attended these 2 days, this most wonderful conference on Acu-con. And I must say that hats off to Dr. Antim Jain, that he comes up with such wonderful ideas, gets such wonderful people, and does such a wonderful job of conducting this conference. I will always try to be here, and wish Dr. Antim Jain to have such many, many conferences every year in the future. Thank you very much.
Thank you very much, sir. Thank you.
Thank you so much, Dr. Yogesh sir, for the essence of our day 2. And बहुत बहुत धन्यवाद प्रेषित करना चाहूंगी मैं हमारे आज के सभी मुख्य अतिथि और हमारे चीफ गेस्ट, जिनकी ब्लेसिंग्स और बेस्ट विशेस के कारण हमारे आज का डे 2 जो है बहुत अच्छे से सक्सेसफुली कंप्लीट हुआ। ऑल्सो एक बार फिर पूरी ऑर्गेनाइजेशन की ओर से सारे स्पीकर्स को भी मेरा धन्यवाद प्रेषित करती हूँ। A big thanks to almost 200 and above of the participants, many more others from our social media platform, कि जिनके कंटिन्यूस जुड़े रहने के कारण ये आज का डे 2 भी डे 1 की तरह ग्रैंड सक्सेस को प्राप्त किया है। एंड ऑल्सो मैं अपना एक सिंसियर अप्रिशिएशन प्रेषित करना चाहूंगी टू आवर कोलैबोरेटर्स एसपी, एस्पस प्रयागराज एंड ईशान बैंगलोर. Also, a huge thanks and special thanks to Dr. A.K. Jain sir, President SB Pass, and to whole SB Pass team for their dedication. बहुत important thanks मैं माननीय श्री शंकर लालवानी सर को, डॉक्टर रूमी बेराम जी सर को और श्री पी लोहिया सर गुरु जी को करना चाहूंगी कि वे आज हमारे साथ जुड़े, उनकी शुभाशीष और शुभ वचनों के साथ, उनके आशीर्वाद के कारण हमारा आज का जो सेशन है वो बहुत अच्छे से कंप्लीट भी हुआ और उनके शुभ वचन हम सभी को मिल पाए, उनका आशीर्वाद मिल पाया। डॉक्टर मयंक शाह सर और जो हमारे कल के चीफ गेस्ट रहे थे के भी प्रेजेंस, डॉक्टर हेमंत ठक्कर सर एंड ठक्कर मैडम, दोनों का भी मैं धन्यवाद प्रेषित करना चाहूंगी सभी की ओर से। एक बार पुनः आप सभी का एक ह्यूज धन्यवाद कि आप सभी हमारे साथ जुड़े रहे। वी आर एक्सपेक्टिंग योर प्रेजेंस इन फ्यूचर ऑल्सो। सो आज के दिन में आप सभी को एक और जो हमारे फ्यूचर कोर्सेस और फ्यूचर जो डिटेल्स है उन सभी के बारे में भी बताना चाहूंगी। उससे पहले एक स्पेशल चीज कि आप सभी जिस भी ग्रुप में जुड़े हुए हैं, आप उस ग्रुप में जरूर जुड़े रहिए, क्योंकि बाकी की जो सभी डिटेल्स है वो आपको इसी ग्रुप में मिलती जाएगी। जो शुभ धन्यवाद है उनके क्रम में मैं आप सभी को एक बार पुनः ध्यान आकर्षित करना चाहूंगी कि हमारे जो आज के स्पीकर्स रहे, डॉक्टर साहिल कपूर, डॉक्टर इंद्रजीत सर, गायत्री मैम एंड डॉक्टर काजल मैम, जिनके इंसाइटफुल सेशंस और जिनकी जो डीप नॉलेज के कारण हम सभी नरिश हो सके आज के इस डे में। देन हमारे साथ डॉक्टर के सत्यलक्ष्मी मैम भी जुड़े NIN पुणे से, उनके वचन के शुभ आशीष भी हम सभी को प्राप्त हुए। एसोसिएट ईशान रविंद्र सर को भी बहुत बहुत धन्यवाद, एंड साथ ही SP एंड एस्पस प्रयागराज, इंडियन एकेडमी ऑफ एक्यूपंक्चर औरंगाबाद, हमारे कोलैबोरेटर्स का भी बहुत बहुत धन्यवाद once again. So now next coming on the courses of our institute. We are working in 3 dimensions: acupressure, acupuncture, then naturopathy and yoga. तीनों ही dimensions में we are providing certificate and diploma courses which are government certified. एंड इन सभी कोर्सेज की जो डिटेल इंफॉर्मेशन है वो आपको सेम उसी ग्रुप में मिलेगी जिसमें आप जुड़े हुए हैं। सो बी देयर, उसी ग्रुप में आपको हमारी अपकमिंग वर्कशॉप जो है उस इंफॉर्मेशन दी जाएगी। ऑल्सो आप जिस ग्रुप में हैं वहाँ हम आपको फीडबैक के लिए एक लिंक शेयर करेंगे जिसमें आप सभी से हमारे इस Acu-con 2025 का फीडबैक आप सभी से एक्सपेक्टेड है। ऑल्सो जो कोर्सेज वी आर प्रोवाइडिंग, जिसमें कि हम एस्पस प्रयागराज संस्थान के साथ के द्वारा संचालित सभी सेमेस्टर कोर्सेज जो है प्रोवाइड करते हैं। सो इफ यू वांट टू एस्टैब्लिश योरसेल्फ एज एन सक्सेसफुल एक्यूपंक्चर और एक्यूप्रेशर प्रैक्टिशनर, तो आप इन कोर्सेज को करके भी अपने आप को अपग्रेड कर सकते हैं। इन फील्ड ऑफ योगा we are connected with YCB Yoga Certification Board, Government of India, जिसमें we are about to start our next batch, Yoga Protocol Instructor Batch 20. हमारे जो सभी पास पार्टिसिपेंट्स हैं, जो हमारे पास पार्टिसिपेंट्स हैं उन सभी ने काफी अच्छे से वर्ल्ड वाइड वे वर्क कर रहे हैं। और आपको भी यदि इस कोर्सेस में इंटरेस्ट रहेगा तो आप अपनी क्वेरीज हमें अपना जो ग्रुप है उसमें डिटेल्स आने पर शेयर कर सकते हैं। ऑल्सो वी आर वर्किंग विद NIN पुणे एंड द अदर ऑर्गेनाइजेशंस फॉर नेचुरोपैथी, तो नेचुरोपैथी के भी हमारे साथ सर्टिफिकेट एंड डिप्लोमा कोर्सेज वी आर प्रोवाइडिंग। In the series of Thanksgiving, I would like to give a big thank to our team, जिसमें हमारे सारे टीम मेंबर्स जिन्होंने इंट्रोडक्शन आज हमारा जो है प्रेजेंट किया। I'd like to thank श्री ब्रजेश गुप्ता सर, आंचल जी, डॉक्टर शिवानी मैम and Miss Darshana. Also, I'd like to thank Chaya Babani ma'am, Kalpana Agrawal ji, and Ravindra sir. And to hold the SB Pass team, we have a big team behind this Acu-con. So आप सभी के कोलैबोरेटिव एंड हम सभी के क्यूमुलेटिव जो एक एफर्ट्स रहे हैं उसी के कारण ये चीज सक्सेस हो सकी है। Also, I would like to thank Preeti Jain ma'am and Dr. Yogesh Kodkani sir also. So thank you so much once again. Big fat thank to Dr. Rinku ma'am, Dr. A.K. Jain sir and Mona ma'am. Also our management team. Thank you so much again. Now I would like to invite Shri Arun Bhatnagar sir from Udaipur for prayer. Over to you, sir.
नमस्कार। आज के समापन पर प्रार्थना के लिए अपॉर्चुनिटी देने के लिए और सभी पार्टिसिपेंट का धन्यवाद। सभी आराम से नमस्कार मुद्रा में बैठेंगे। सभी के अच्छे स्वास्थ्य के लिए हम प्रार्थना करेंगे। सर्वे Sorry. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामय सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्। ॐ शान्ति शान्ति शांति। सभी का आभार। थैंक यू।
Thank you very much, everyone, for the joining us. We will meet for the next shortly in the next workshop. Thank you very much. Good day.